Indianapolis. So we had two major collisions, one on 37 getting onto 69, and then once you got there, then you got to wait for the next crash, which was down at 69 and 37. So, or 69 and 4. Yeah. Where's Carl Browning when you need him, you know? This is the first presentation will be with the Supreme Court, and we have the Chief Justice, Loretta Rush, with us. Thank you very much for coming, Chief Justice, and congratulations on your appointment. And I see that you have a full core of support behind you today, and so I'll turn the floor over to you. Thank you. Do you have the blue light on your mic?
Oh, it's on now.
Great. We webcast these presentations, and it does help on the speaker here, but it's really mostly for the webcast so that people who are watching can follow.
Well, as a summary, I have the rest of my court here today, along with Chief Judge Vedic is here, and Paul Mathias, who is working with the Supreme Court and co-chairing our new court technology. So thank you. I appreciate the work that you're doing in putting this together. So when I looked at presenting the budget and I was reviewing the numbers, given last week was Statehood Day, 2 years we're going to celebrate 200 years of our state, I thought I'd go to the Indiana Constitution. And I have this material before you, and what was the General Assembly's charge to the courts? As the Supreme Court is in charge of the jurisdiction, supervision of the trial courts, and this is actually my favorite phrase from the Constitution. All courts shall be open, and every person for injury done to him in his person, property, or reputation shall have remedy by due course of law. Justice shall be administered freely and without purchase, completely and without delay, speedily, without denial and speedily without delay. So most of the budget requests we have today tie right into the General Assembly's original charge to the court. So I'm going to go through just some of the budget requests, some of the new budget requests, and then some of our additional with our additional ones. So I'm going to start with, and this is too hard to read up there, but I did supply you with an 11 by 17 earlier this week, and I think some of you have seen this. I'm going to start with our budget request by going through some of court technology. What is very apparent to me, it was as a trial court judge and as now the Chief Justice and the Chief Justice, is how do we deliver justice better? How do we fulfill this constitutional charge? We have to constantly be looking at technology. So I'm really proud of the accomplishments of our court technology, and the General Assembly has been our partner with that over the years. And this is an example of the interfaces between Indiana court technology, state, local, and federal government. We have developed over 30 different applications that really interact or interface with all counties, many different branches, or many different government agencies. And just a couple of examples are e-tickets. Law officer pulls you over, which I hope they didn't pull you over today, pulls you over. Instead of spending time manually putting this in, sending it in, and manually putting in time and time again, it's an e-ticket. So far through this application, 1.3 million e-tickets have been issued in the state. With the collection of child support, 4D, the writ warrant registry we're doing with regard to looking at supporting our children and getting those timely filed and warrants registered. The protection order registry, as a judge, it used to just manually put those in, and then they would be sent, and then it would be, again, inputted several times. We could do a protective order registry right from the bench. 93,000 have been done statewide on that, and that's immediate text or email alerts to the victims. So these applications, I'm just giving you just a couple of them today that we have developed through court technology, really are key to public safety. The BNV, and I checked this number again this morning, with regard to looking at SR-16, which are licensed. 15,000 of those are being transmitted to the Bureau of Motor Vehicles each week. Risk assessments, looking at the level of risk an offender would have within the community. We have those online, and we've done over 607,000. So that's just these are inside applications, and this is just a sampling of what we have and what we hope to be able to continue, maintain, and sustain through your help with funding. Next, a crucial step for court technology is to implement electronic filing in all of our courts statewide. And this isn't something we just came up with. When Chief Justice Dixon was chief, he started this 2 years ago. We had 22 stakeholders from local government, we had clerks, we had business. We tried to get all the different users of the courts to get together to look at the rules we have on e-filing, to look at what providers would be, to make sure that they wanted it. That work has come to us, to the Supreme Court. And I just want you to imagine tens of millions of pages of paper statewide being filed, stapled, refiled, stored. We're constantly looking for ways where to put the documents we have. And I may have told a couple of you this, but even as Chief Justice, there's banker boxes full of documents I don't know where to put. And it's like if you open up a closet, they'll come falling out at you. And I have one case I have in front of the front bench in the Supreme Court. I've got banker boxes. So I think the time to save money with regard to, one, it makes good business sense to file things electronically, for people to get notices of court hearings, for transparency, accountability, to sort of say 200 years of paper, we need to move away from it. States generally are other states are, I believe, ahead of us with regard to looking at the electronic filing. One of our asks is to start piloting this. It doesn't happen immediately. We're looking at 3 or 4 pilots. Along with the appellate court, we're looking at, in the budget, I had $2 million for the first year, $4 million for the second, but then once we're up and going with electronic filing, an unlimited license for all e-filing for the state would be about $5 million. And it is something that we're asking for. We believe strongly that by going away from paper and going to that, it will save more than that. And I welcome any type of fiscal impact we can get on that. So that is one of the big things that we're asking to partner with you on.
Chief Justice, could you help me, if you know, or if somebody can help you, identify the line where you're talking about the 2, 2, and the 5, just so I can sort of relate I understand your comment, but I want to make sure that I know where it is here in this format.
On 10760,
Pardon?
trial court operations,
What line number is that?
60.
Third one. Third one on the front page.
Okay, 10760, and then, so we're, the numbers that we show says trial court operations, and the number has been a very low number, and then it jumps to 25 million in total. So is what you're suggesting part of that breakdown?
Part of that is the technology. Part of that includes probation salaries.
So I guess it would be, in order to identify what you think is going to go for each purpose, if that's all lumped into the $25 million, I wonder if whoever your bookkeeping specialist is could break that down for us so that we see how much is for this technology, for the electronic filing, and how much is for
Sure. And when we put it out for bid, and we had a range of bids that went up to $22 million a year. So we had the committee of stakeholders we talked about with regard to local government, business.
Okay.
Judge Mathias was on that. They settled with one, and it would be about $5.2 million once it's up and running. We would negotiate the contract with them to have less in the first 2 years while we're piloting, but we think it's important to get that unlimited license. So the original ask of $2 million for next year, and then $4 million for the other, would be as we're piloting and expanding and rolling it out to the different counties.
So we're asking for $2 million the first year.
In the original budget submission.
So, well, what do you want now? Just tell me where you are now, if you know.
You know, the number that we're talking about, we're not done with negotiations, but the first year, it's not 5 to do electronic filing. It would be approximately $2 million the first year to do just the electronic filing. It'd be approximately $4 million the second year to do it. And
Okay.
then from there on after, once we roll it out to all the counties, we're negotiating a contract for an unlimited license that would be 5.2 million.
5.2 million. And so I know that will be a really huge advance for the courts. I mean, that's just common sense. But now we're going to spend 5.2 million a year more. Is there some way that there's actually a tangible savings offset somewhere in the budget? Or is this just the necessity cost of having the more efficient and more effective system? Is there a way to,
You know, and they looked at, and I was just looking at other states, and Manatee County is just one county that implemented electronic filing, and they were able to show savings of $1 million a year in that county. Again, a larger Florida
the
county.
county achieve some savings because of the labor that they save?
Also, when you look at state administrative agencies that are sending documents over, when you look at governmental agencies, the Attorney General, the different government, you look at our clerk's office.
But if 90% of the savings are going to be in the savings of personnel at the county level, the thoughts that occur to me are, number one, the counties are not going to fire anybody and save that money. Actually, they're going to continue to find other jobs or something else for them to do. So, but they're asking the state to pay for it. So I guess one of the conversations we need to have over the next few months, and not today, we're just identifying issues at this point, is should the counties pay some of the 5.2 million as a share from the savings that they're going to get, which are going to exceed that. I think we're going to have to think in those terms here.
I agree with it being 90-10, because when I look at all the state players that we have in the
Okay.
court system,
Well, if it's not 90-10, I understand that number. I just threw that out as a guesstimate on my part, and it obviously could be wrong.
cost savings sort of across the board. When you look at, you know, having a healthy business environment, when we're looking.
But you're asking the state to pay 5.2 million a year more. And so if you can show me that the state cost savings are 5.2 million, then at least I have a case in
Sure.
front of me that says I'm ahead on the deal. Now, if the savings are mostly to the counties, because that's where the personnel are located that do all the filing systems, then we need to examine the issue of whether or not they won't produce any savings unless you require them to account for
For
that.
general fund, will they do it? They have shown in other states that with regard to positions that they have not filled, so there have been some savings, that it wasn't just we
Okay.
kept the same players, but we didn't need them for the storage. And I did talk to Senator Waltz about this, and he actually looked at and asked Legislative Services to help us and started
Okay.
the ball rolling on getting a
Good.
fiscal impact, which I think would be helpful.
Well, we know we're going to have to go to e-filing, even if we have to pay the 5.2 million. But as a budgeteer, I'm trying to decide, is there a savings component to this?
Also, we're looking at the economies of scale by doing it statewide, as
Sure.
opposed to getting an unlimited license, as opposed to, because it ended up being 3.8 million to do 500,000 cases, so there's an economies of scale if we put it together.
I can't speak for the other members of the Budget Committee, but I'm certainly willing to work with you on this and recognize the probable need. But I'm trying to push it into an exercise that's the most efficient cost-wise that I can get to and recognizes the savings.
Great. So the other is another piece of core technology, which the General Assembly has funded, is the Odyssey program. We are now, I'm happy to report, we now have Odyssey, which is a case management system installed in 217 courts in 51 counties, with more counties in place. We just recently put the tax court on Odyssey, and we will be putting the appellate courts on Odyssey to replace the AS400 that we're currently using. So that shows the stars represent city and town court judges. If the whole county is shaded, that it's the city and town court judge, in the star, the entire. The other, I want to talk about the funding for court technology right now, and I think Senator Kenley, you brought that up. And one of the things I've been looking at and trying to to wrap myself around is the automated record fee. And that is how we fund core technology right now. And I'll sort of walk you through this diagram. We had 1.6 million cases filed, so when you think that it's $7 record fee, then, well, that should be 1.6 times 7, but there's not a filing fee collected in every case. You've got criminal cases, indigent cases, cases filed by the Department of Child Services. What actually we received from filing fees to pay for core technology in the last full fiscal year was $4.8 million. So when a case gets filed, and that's $7, part of it goes elsewhere. If there's a diversion, it goes to the Attorney General. $2 are retained by counties that are not Odyssey counties, and then $2.6 million by statute goes to 8 other recipients that I didn't list here. So in looking at what we have to...
So of the 4.8 million, 2.6 million is siphoned off for other?
That's before. We end up with that. When you look at the $7 from all the cases, what comes down to, it's 4.8 million we receive from filing fees. Not all of that is from the automated record fee, because there are other statutes that say some of it needs to go to us, but that's what we get. That's our state funding that comes from for filing fees. So when I'm looking at, there's a $2 fee that'll be sunsetted. So then we will be, if nothing changes in this budget session and that $2 isn't there anymore, we will be down to about 3.6 million to fund all of our technology. So when you look at e-filing, those inside applications, those public safety applications, continuing to give case management to the counties that want it, we really are, we're just stalled in the water with that sunsetted $2.
Okay, so the $2, if that's gone, then you're down to, what is your gross receipt?
And
3 million, and if you have to pay, and on the other example, you're paying off 2.2 million, so if you have to pay off 2.2 million, you'll be at 800,000 that you'll have.
It's a bleak picture for funding core technology. So when you...
Am I saying those numbers correctly? Do you know?
2.6 million does not come out of the 4.8 million. The 2.6 million comes out of the automated record fee because there's a statute, and that particular statute has 8 different places that part of the automated...
So the 4.8 million is not an estimate of what the $7 automatic record-keeping fee...
dollar amount that we receive once everything else is paid off of that $7. So when you say there's 5 plus 2, some things are siphoned off, but the end product, what we get from all of the filing fee for core technology in our last fiscal year is 4.8 million.
Well, let me say it a little different way, just so we can make sure we're on the same page here. So the $7 fee generates a gross amount of 4.8 million. You're having to pay off, because some of the fee is designated for different uses.
That's before we pay that 2.6 before that. The 4.8 is the net, the total net.
Okay, so, all right, let's don't go too long on this, but maybe you could have your person say, here's what the $7 generates in total. Here's what is diverted off for each amount. We end up with 4.8 million. And then somehow or other you were taking more money out of the 4.8 and said you only end up with 2.6. And so I didn't follow that step either.
One of the problems with not having an integrated case management system, that the clerk's records, we don't have the ability to go into every county. I mean, some of the systems talk, some of them don't talk. So we have the end amount that comes from filing fee, and that's one of our challenges on not having an integrated system.
Okay. Well, since we're going to be discussing during the session renewing the $2 fee and determining what the appropriate fee is going forward, I think it's going to be important that some of us understand explicitly what that is.
I put this together for the first time so that I would understand it, because it was hard.
Okay.
The other thing that I'm going to show you and walk through is how are your courts funded? And this is a graph that shows, and I took out of this graph...
Before we go to that, Representative Gooden has a question here.
Thank you, Mr. Chairman. A real quick question. Would you be supportive of requiring all local counties to be able to communicate with your communication system, with your computer system? We run in the same situation not with just the court systems, but with the auditors. Every county has their own computer system and their own data management system. And then when records are requested, 9 out of 10 times, as you said, the communications, they don't talk to each other
We
in
have to
simple
have
terms.
systems that are integrated. When you look at what the state's doing with the Management Performance Hub, we have to, if you want to do good government, if you want to hold us accountable and be transparent, we have to be able to talk. And I'm going to talk in a little bit about rolling out the reforms from House Bill 1006. You want to make sure that they're in place. You want to be able to track recidivism rates. I had a question. When we are looking at criminal code reform, how many people are in jail in Indiana on a failure to appear? Can you get me that information? No, I can't get you that. Well, we are being responsible for the trial courts. We are looking at how to be better.
I
And part of
understand.
how to be better, but yes, I want them to be able to talk to each other. Do I want to say this is the system and, we're only going to look this? I'm really looking at a fully integrated system.
Well, and I agree with you. And a couple of years ago, we pandered around with this, and I've been requesting this for years. As school corporations, we have to adopt systems that will talk with the Department of Education system, and that is a requirement to do that. And there's no reason why we don't require the counties to do the same. So we'll let you move forward.
It's a
But
wonderful
I think it's
question.
critical that we do
I
that.
think it's another question I had is, how many kids that have been wards of the court graduate from high school?
Right.
Well, we don't have that. We don't link our kids that are in welfare with education.
Right.
And I think, we're a great state. We can just do so much better with some
Well,
technology.
you showed earlier the pictures of the boxes of records that you have, and I know you've probably visited some county courts.
I
And those
worked in
boxes
county
are stacked
courts.
higher than that in
Well,
those
we
county
don't-
courts. It's ridiculous. But we'll move forward.
Paying money, the counties are saying it's $500,000 to microfiche in one county, and we're doing that at the state level. So we need to quantify and get that to you. This is, I wanted to see, our court wanted to see how we're funded. And in this particular chart, the blue is general fund funding, the orange is other funding, which could be attorney, registration fees, board of law examiner fees, grants that we're getting. And I took out, we have some pass-through accounts with regard to local judge salaries and prosecutors, but this is where our funding is. Court operations, public defender legal aid, court access, all of court technology, we spent about $6.3 million in our last fiscal year. That goes back to that records fee. What will happen if it goes down to 3 with us being able to run the courts? So this just shows you what we have. Of the non-salaried, the $54 million, 59% is funded by general fund and 41% is funded by other sources. We did significantly raise the attorney fee registration to help fund our programs. We increased CLE, so we do look at what user fees we're able to collect so that we can be good partners in government. We did ask with regard to the whole Supreme Court agency structure, we've asked the National Center for State Courts to come in and really do a top-to-bottom evaluation to see if we're the most efficient, and we'll have that sometime next fall. So that's just what comes from the budget, what comes from user fees. I wanted you to see that. Here's a couple of new asks that are in the budget with regard to implementing criminal code reform, community supervision grants, probation salaries, some technology maintenance on risk assessment, probation training, and juvenile detention alternatives. I included juvenile detention alternatives in here because part of the goals and the mission of criminal code reform directly relates to what we're doing with our kids and keeping them out of the system. In Tippecanoe County, we had, when I was a trial court judge, our jail was overcrowded, so we took a snapshot in a day. 50% of the jail were people 24 and younger.
Senator Italian, I think, has a question.
Thank you. Yeah, I'd like to ask you, I've read this one,
Budget transfer.
and now I'm looking at this one.
Yes.
And I have a question because I'm a little confused about this. The probation salaries that you're talking about here is a new ask, call it $20 million. These are to take over the current salaries of the chief and the deputy at the county level? Is that what I'm understanding?
Either that or for two new. It'd be, each county would have two chief, the head probation officer, and then the deputy would be covered by state funds. In looking at judge's salary, prosecutor's salary, implementing criminal code reform, we are going to be putting more in our probation departments with regard to supervising. So this is a policy decision the state will make. This is our recommendation for you to consider, that we think this would help with fulfilling the missions of criminal code reform for every county, for the state to take over payment of two.
So would you restate what you're asking the state to pick up that totals the $19.5 million? You're asking that
Each county,
two positions, which are,
which would be the lead probation officer and the
Chief.
deputy. Chief probation officer
and
and one deputy.
you're asking that we pay that 100%.
Of those two positions.
I'm not done.
Okay.
Can I?
Yes, please go ahead.
Yeah, I'm a little worried about that. A couple of years ago, when we started talking about how to implement 1006, there was a discussion that started out with, let's fund one new probation officer in each county, or let's fund a probation officer in each county. And there was a kind of bipartisan House and Senate group that was looking at this, and we said, that's probably not a good idea, because all that's going to do is supplant money. The county's already spending it, we're going to take this money and pay for what we're already getting, when what we really want is more. We want more probation officers. And so one of the things that we talked about was doing a grant program somewhere in this area. It wasn't quite that much, but we were talking about doing a grant program so that counties who needed additional probation officers, and some need them more than others, could get that money. That spending of $10, $20 million, whatever it is, would buy us additional probation officers instead of just paying for the salaries of people who are already there.
I think your point's
Why
well
did you
taken.
go this way?
Well, this was in our budget request the last time, and it could be structured. I think that's wise. I mean, I think that's why. When you look at probation caseloads, and you look at saying we want to keep more in the community, and we want local supervision, and how many per probation officer have high, medium, low risk, I think your point's well taken, and I would agree.
Madam Chief Justice, you've already set aside a couple of folks, member of your court, member of the Court of Appeals, to help work with the technology issues. And I'm thinking, in following up on Senator Tallien's recommendation here, that it might be a good idea for you to identify perhaps another member of your court, plus maybe either a trial court judge or a Court of Appeals court judge who has trial court experience in criminal matters, particularly, to work with through the session. I think, don't you think we're going to need to keep that contact to do that?
I think that we're going to need to keep that group together, which
Yes.
was, several legislators plus the courts and DOC.
You have a very easy job. All you have to do is convince Dr. Brown and I that you need these millions of dollars, okay?
Well, and we're open. I mean, this is going to be this is a policy choice the state will make. We're making recommendations, but I really like your idea. Why do it if it's not going to? You want a lot of bang for your buck on this, so you really want to say, if you're going to do this,
There's been
you
so
wanna make
much
sure.
work by the people that put together House Bill 10006, and I think that your assistance would only be helpful in terms of filling out the picture now that the day has come here.
And that we want it to work.
And then, Senator Tallien, did you have more questions on this page here? Because I had a couple, if you didn't.
Just a couple of things. One of the things that we did last time was to put some money out there for training probation officers, or for establishing a program to train new probation officers in-house. Has that happened?
It has started. In fact, when we're looking at the training that we're doing, there is an ask for an additional training, but there have been extensive, I think I've got the hours here, how many hours that we've required probation officers to do training, and it's been significant. Certifying, testing, training probation officers. Yes, Representative.
Okay, Representative Gooden, go ahead.
Not to get bogged down on this situation, but would you support expanding the powers of probation officers and correction officers to the point where they are allowed to make arrest under certain circumstances? I've had several probation officers and correction officers contact me about that, saying they get in situations and they really have no ability to.
You know, Representative Gooden, that's a really good question. The chief is here today to present the budget. I'm not sure,
This is related to the budget as we go.
okay.
I'm sorry.
Yeah, I mean, and I would be happy to talk. I'm in room 324.
Yeah,
Right,
and
one
we're-
foot down. I mean, I would be happy to talk because I think the idea of really getting the maximum use out of probation officers with regard to public safety, working with the courts, implementing the reforms in House Bill 1006 are key. So I think that we have a probation committee within the Judicial Center that we're looking for best practices and ways to improve, and that issue may fit in there.
And the reason I asked that during the budget part is because I think we can rearrange some probation dollars if we expand the abilities of those probation officers or the correction group as they work with the local judges. So thank you, Mr. Chairman. Thank you, Chief.
All right, and sort of going through we received $2 million towards community supervision grants. We actually had significantly more counties that asked for it. We were able to give it to these counties. Part of what we're asking for is more money to have communities to expand that program that we have. It has been, I'm trying to think, was it 32 counties that applied?
So let me ask you, let me interrupt you. I apologize for that. And so the $2 million that you got for community supervision grants was for grant programs for the supervision of people who were going through the courts and then were being diverted or put on probation in some way, shape, or form. Is that right? So the Department of Corrections has had a program, have they not, Brian, that they give counties grant money based on their share of community corrections type grants.
Yes.
So is this another source of dollars for the same purpose, and should those sources be considered together, or am I missing something here?
And I don't know with regard to the DOC. I've not seen their budget, whether it's a reentry coming from the community. What we did when setting these grants up, we looked at evidence-based interventions, mental health, substance abuse treatment for medium, a lot of them are for medium to high risk, or moderate to high risk offenders. In Warren County, it was for addiction, mental health treatment, and case management. Porter Stark County is $175,000, psychiatric services. Marion County, it was keeping 50 moderate to high risk offenders locally with regard to addictions treatment. We monitor the grants. We have standards that they have to. We're willing to continue to do this and be the administrative source for rolling out this community supervision. But the best thing would be to partner with the Department of Corrections. And if we can partner with them and we're serving the same body, the same thing we're doing in JDAI.
It feels on the surface like there's a potential duplication here, and so I'm just trying to,
We'll meet with them and get back to you on that, because we don't want to duplicate that, but it has been hugely successful. And actually, the first time we set this out, when we received this money from you, 32 different counties applied, and we have a lot more, particularly with rolling this out. I'm going to talk briefly about juvenile detention alternatives. We have it in 19 counties. The Study Commission this summer, Criminal Code Reform, asked us to expedite the expansion of that. So we would hope to be able to expand it from the 19 to 24. I've got some quick data points for you with regard to rearrest rates, Department of Corrections commitment. And again, when you look at
so this is an expansion of the JDAI initiative. Now, I think Justice David was the one that has tried to work and put this together. So if we're in, is it 19 courts or 19 counties?
and we're looking at, so it's all the juvenile on that. And I think it's right, is it 56%, Justice David, of the juveniles in the state are in a JDA? We've got the big counties.
I mean, what percent?
56% of the juveniles in the state right now are being maintained by, in a county that's a JDAI county.
So in rough terms, my exposure of where you want to go is, this would only be 50% of that. So the potential of the program is about $6 million. Is that right?
For the
I just
ask
want to
for
know
2
where
years.
I'm going.
We're-
When I first signed up for the First Steps program, it would cost us $5 million. When we got done, it was $60 million. So I'm trying to avoid compounding my mistakes here by making sure I know where I'm going, that's all.
We're looking at, when you look at the Juvenile Department of Corrections, they've been able to close 2 facilities with regard to, when you look at average bed days, average daily population, those are how many children are in a detention facility in a JDA county per night. And we're looking at decreasing it. So state dollars with regard to DOC, local dollars with regard to detention. It's a data-rich program, so we were asked by, it wasn't in our original ask, we were looking at slowly doing it. We've done it to date by grants, but we were actually asked by the legislators on that committee to what would it cost if we expedited and expanded.
That, what we need is probably, as we move through the next months on this one, too, we need to see what the projected movement and the cost would be, and then where we would be with a full-blown program. And then if there are savings that you can identify, it would be very helpful for you to kind of point us to those so we can make sure, because my guess would be if it's monies that are somewhere else in the budget, those folks are probably not reducing their request. And so if there truly are some savings, and there may or there may not be, it may be an item that has been neglected, and so it's something that just has to be spent.
It's a partnership between the Department of Corrections, Department of Child Services,
Okay.
Criminal Justice Institute. So we're working with the other state
Okay.
players on this, and some of the savings with regard to diverting from the criminal justice system, it's hard to put a dollar amount on that, but there are tangible savings with regard to less kids being locked up right now.
Well, that's great, and that's, of course, that's always an objective, but in terms of our measurement, since this is an additional request, if we could have continued dialogue on that, it would be helpful.
And I was using this opportunity for you to get back to me, to give me feedback on what you wanted more of, so that's a
Okay.
wonderful question. A couple of the other, just I categorized.
Budget Director Bailey also has some questions in that area.
Question about the JDI program and the measurements that are used. On the juvenile reoffense rate, is that a measure of rearrest or is it conviction upon committing some subsequent crime?
Is it rearrest or is it conviction? It's rearrest.
Okay, thank you.
There's some additional funds for the Galcasa program. We have rolled it out to more counties. There are about 3,000 children that are wards of the court right now that don't have it. The CASA program provides about 400,000 hours volunteers for the 19,000 children that are it. We think it's a good program, so we are requesting, we want to grow that program, and the money is needed for the training of the volunteers. Court interpreter program, there is an ask for increase in court interpreter. The Department of Justice sets standards. There are lawsuits pending, including one against us with regard to Department of Justice interpretations. So in Indiana, in the last census, we had about 500,000 people who spoke languages other than English. We're required and believe access to courts. We need to look at the limited English proficiency. So we do have some money with regard to certifying and training probation officers. Mortgage foreclosure assistance, there's a sunset on the filing fee. We still have cases. There have been about 25,000 borrowers that have gone through that program. More than 5,000 Indiana Hoosiers were able to stay in their homes. Again, there's some information with regard to the value that brings to the community. So we're asking that the filing fee that expired at the end of this year would continue at least for the next year or so we can continue that program.
Senator Tallon, I think, has some questions in this area.
I just wanted to say, right now, that money that you get on the filing fee is a transfer, right?
It's $50, yeah, it's $50.
And And I believe, I work on that mortgage foreclosure task force group. I believe there's kind of an agreement that part of this year's legislation is going to extend that, so that money will still stay in the dedicated.
We may not need it. There was a settlement that we received that's coming in through the Indiana Bar Foundation. I'll know more in January, which could be upwards of $600,000 that can be attributed to that, which would make the total ask about $300,000. There's some possible money that in a settlement that may be put in a fund to help pay this, so we may not need it. I'll know more within the next month.
So on those court access programs, I think you said you were asking for increases in these specific areas, and so as you, I don't know if it's identifiable on this budget form, or once again, if I could see the comparative numbers and see what you're asking for in a more detailed basis going forward, that will help me a lot.
We will get those specifics. Public Defender Commission, Public Defender funding with regard to access to justice, just an example, in looking at when it's required for a court to appoint counsel. They did a snapshot on kids in DOC and waived to the adult court. Half of them had not had representation. They are required to have representation now, so there will be some additional asks for the Public Defender fees, but we'll get those to you. New personnel requests. These are the new positions that we're asking for. It's in the budget. We've talked about an education attorney for probation. We're asking for additional security. We've had some security issues, so they're there and spelled out. And then finally, we like partnering with you. We believe courts are a good investment. I said out loud my room number here in the State House. Please feel free to come ask any of us questions at any time. I think I appreciate the dialogue with regard to these. I know I hit a lot of these areas fast, being respectful of the time that you've set, but the areas that you gave us that you want more information, we will be getting that information to you.
Great. Thank you. Chairman Brown.
Thank you, and thank you. I know being new to this committee also, it's sometimes difficult to comprehend what people are going to ask. I've been hearing a lot about adult guardianship. Do you want to have any comment on adult guardianship and where we need to go there?
We are. Well, I mean, when you look at our aging population, in fact, I just asked for those demographics the other day. In 5 years, how many of our population is over 70? We're seeing more and more of a need for adult guardianships. We did write a grant, got a pretty significant grant for adult guardianships and elder abuse that we're piloting up in northern part of Indiana. Judge Henderson started a guardianship registry so that that information can go from county to county as that. But the needs of our elderly and access to the court and protection, a big issue that we think that we're responsible for. So we are piloting projects. We are seeking grant money. We did not have a specific ask because we want to use the grant money to pilot the projects to see how successful they are. But you'll be hearing more over the years as more and more of our greatest generation is going to be coming and needing protection from the courts.
Do you think it's delaying timeliness through the court because there aren't guardians out there?
I think that's something we have to look at daily with regard to timeliness. If you've got an elder abuse, or if you've got a need for guardianship or a need for guardianship to be monitored, people need to be able to get into court, have representation, access to court. You have a need for guardianship, but who can file it? We're looking at how do we creatively come up for ways, particularly in the civil arena, to get attorneys to donate their time. A lot of times, sometimes in a guardianship, there's not funding with regard to get that access. So those access issues, we did do a rule last year that mandatory reporting of pro bono for attorneys, sort of an aspirational goal. We're trying to find creative ways to increase access to the courts. But I tell you, the cases that are coming that I saw from the trial bench, I'm seeing with regard to elder, we need to address. And we're mindful, but great.
Any other questions? Well, we've had a lot of dialogue, but I think it's beneficial to where we're going the next few months, and I'm sure we can work together to try to deal with.
questions, or even after the meeting, if you have any questions or follow-up, she talked really fast, I'm not sure what she said here, please feel free to email me and get a hold of me.
Thank you for your presentation.
Thank you.
Okay, next, we have the Department of Health. I'm sure they're out there. Oh, really? Morning, gentlemen. Good to see you. Understand that, Dr. Adams, that you're new on the job. Is that right?
October 22nd.
Okay.
So be gentle with me.
Be gentle.
Representative Gooden told me he was going to be nice to me.
Well, you don't want to really believe everything you hear in the State House, okay? Well, thank you for taking the job and being with us and providing this public service. And also, we want to thank your staff at the Department of Health for the good work that they've done the last couple of years, and we do appreciate everybody's efforts. It's Indiana has a reputation for being a well-run state, and so that wouldn't happen if we didn't have good employees everywhere. And our objective is not only to continue with that model, but to improve services for our constituents wherever we can. So with that, I'll turn the floor over to you, and you need to make sure that that blue light is on your microphone there.
Our blue light's on.
Okay.
And thank you all for your time. I know we're running behind schedule. Our plan is for me to spend 3 or 4 minutes and give you a general overview, and then I'll turn it over to our CFO, Joe Fistrovich, to present more of the financial details. Again, I'm Jerome Adams. I'm your new State Health Commissioner, proud to be your new State Health Commissioner. I thought it'd be helpful to give you just a tiny bit of my background to start off. I received my medical doctorate from Indiana University and my master's in public health from the University of California, Berkeley. I've lived in Indiana for 17 years, and I have a wife and 3 children, and we live just south of you in Fishers. In addition to my
I hope you got here easier than I did today. It was pretty tough.
hospital, so.
Oh, did you? Well,
So it was
good.
easy. In addition to my duties with the state, I'm an assistant professor of anesthesiology at Indiana University downtown, and I practice at Eskenazi Health. We ready with the first slide, or you want me to go in?
We're looking for it, sir.
Okay. Well, again, we're running behind, so would you like me to continue or wait for the slide?
Why don't you go ahead? We all have a copy of this here.
Say, I thought we passed out copies. Well, at the Indiana State Department of Health, we promote and provide essential health services with the goal of a healthier and safer Indiana. I oversee 4 commissions and an operational support division with 776 employees. Prior to 2003, we had 5 commissions, but we consolidated 2 of those commissions into 1, so now we have a total of 4. Our Health and Human Services Commission administers the majority of our federal funding, which makes up nearly 2/3 of our agency's total funding. Health and Human Services focuses on primary prevention strategies and direct human contact to improve health outcomes in our state. The Healthcare Quality and Regulatory Commission focuses on licensing and oversight of healthcare facilities. our Public Health and Preparedness and Laboratory Services Commission, these are the two that were consolidated, deals with our readiness activities and manages our state lab. And then finally, the Tobacco Prevention and Cessation Commission focuses on reducing smoking and reducing the burden of tobacco use on Hoosiers. Right there. I'd like to thank you all for your past appropriations and highlight for you a few of the agency's major accomplishments over the last 2 years to show you that we are using your money wisely. Specifically, I'll discuss our efforts to decrease infant mortality in our state, our progress in reducing smoking rates, and our success in the prevention of infectious disease outbreaks. We're all aware of our state's unfortunate and dismal rankings on infant mortality, and that's why Governor Pence has been a leader on this issue. It was one of the things that spurred me to take this job, the fact that he was willing to step up and make that a priority. While concerned about our rankings, we're excited about the efforts we've undertaken to move the needle on this important public health issue. As part of those efforts, we hosted the second annual Infant Mortality Summit last month. Over 700 people attended. We brought together experts from across the state and the country to highlight the need for partnerships on infant mortality. Additionally, we awarded $1 million in April to 11 grantees working on innovative projects to decrease infant mortality across the state and in your communities. As required by Senate Enrolled Act 408, we convened an expert task force on neonatal abstinence syndrome and just last week submitted to the legislature a report and recommendations on this topic. We implemented the Baby and Me Tobacco-Free program, an evidence-based program to lower tobacco use among pregnant women and new moms at 8 sites across the state, and we're hoping to expand it next year. And we also worked with Anthem and the State Office of Medicaid Policy and Planning to change Medicaid policy. You're probably familiar with this, but as of July 1st of this year, Medicaid no longer pays for elective deliveries without a medical indication, as that's been an intervention found in other areas to reduce infant mortality rates. Moving to our second highlight, I'm proud to say this is the first time ever that Indiana does not fall into the bottom 10 states for adult smoking rates. We've seen a steady decrease in this metric over time. In fact, we've decreased from approximately 26% to 22%. And that may not sound like a lot, but that's an 18% decrease in our adult smoking rates over the last 2 years. We're proud that the Indiana Tobacco Quit line, 1-800-QUIT-NOW, please promote it, has served over 100,000 Hoosiers with 11,000 helped in 2014. And I'm also proud to say that Attorney General Zeller is co-chair of the Tobacco Committee for the National Association of Attorneys General and has been helping with our youth tobacco cessation efforts throughout the state. And then finally, while Ebola has stolen the most recent headlines, the State Department of Health has managed multiple infectious disease outbreaks in the past 2 years.
Senator Talion has a question, if you could.
Could I just ask you about you just talked about some great results you've had on tobacco cessation.
Yes, ma'am.
But in the last budget, we cut your budget by a whole bunch. What effect did that have on your programs?
Well, I'm a firm believer both as the health commissioner and as a taxpayer that spending more doesn't necessarily mean spending wisely. What I can promise you is that we're looking into all the interventions that we're putting into effect in the state to make sure we're spending that money wisely. But again, I'd highlight that we've decreased our smoking rates by 18%, and we served over 11,000 Hoosiers with the Quit line last year. So we are seeing progress on this issue.
When you say you've decreased smoking by 18%, what period of time are you talking about?
That's over the past 2 years, the past biennium since the last budget.
Okay, thank you.
Oh, no problem. That's a great question. As far as infectious disease, we've dealt with enterovirus, D68, shigellosis, hepatitis A, salmonellosis, campylobacteriosis, viral gastroenteritis. And many of you have probably heard about our first American case of MERS, or Middle East Respiratory Virus, for which our state received national recognition for how well we handled that in Munster, Indiana. On the Ebola front, which you all have heard about, we've worked closely with local partners to develop protocols and implemented travel monitoring, which is more stringent than the CDC recommendations. And our state laboratory is now capable of testing for the Ebola virus, so we don't have to send our test results out of state and we can get results back more quickly. Just yesterday, I was in Paoli, Indiana, as part of our efforts to get out to all 10 public health preparedness districts across the state and make sure they're prepared not only for Ebola, but for whatever infectious disease or public health crisis comes after Ebola. A personal priority of mine and an ISDH emphasis is getting out to Indy and to the communities, where the local health departments and community members are doing a tremendous amount of public health work in the state. And I want to tell all of you all that please let us know if you have any concerns in your districts and your counties, and please thank the people who are doing the hard work there. With that, I will turn it over to Joe Fistrovitz to talk about the financial details.
You all should have the report of the agency operating account summary. I'm going to go over the highlights, and then we'll be prepared to answer any questions you have on our budget specifically. As you see, the legislature, the governor funds the health department primarily through federal grants. We have about 108. I'm sorry. Thank you. Thank you. Our primary source of funding for the Department of Health is federal dollars, grant awards that we receive. 180 million approximately, which accounts for about 66% of our total budget. The next biggest funding source is about 63.4 million in dedicated funds, which is the basically primarily tobacco money, but also some other funds that are thrown in there by legislative fee or things like that. And then the last bump, which is as important, is the general fund, which accounts for about $31 million of our total appropriation. And just to break down the general fund, we, by our budget instructions from the budget agency, we did reduce our general fund appropriation. We met our 3% target, and we hit that. And we just wanted to show you that other than for the CDHHE funding that the legislature granted us last session, our general fund is primarily flat, other than the 3% that we did implement this
Joe,
year.
do you think you're going to be able to manage the department on that number?
Yes, sir.
Okay.
We did receive we were allowed, the budget agency, after talking to them, we are going to be asking for 2 change packages. One, and they're mainly technology driven. The first one is for $500,000 in year 1 only. And what that is allow us to be, we have a lot of old servers that we need to replace that house all our software. And in addition to that, that money is also going to be used to temporarily hire some programmers to help basically transfer our programs from the old servers to the new servers, and also then make sure our software programs meet the IoT protocols for software that are on their servers, technical lingo, I guess. But that's what we're going to be doing with that money. And the second change package we're requesting is $1.5 million in the first year, and then what's not on there is $1.4 million the second year. Basically, we're going to be we're requesting to replace our Vital Records software package, which is dated. It's with a vendor now, and we were going to take it out to RFP and see what kind of solutions we can get in the marketplace. We wanted to give you a quick look at our total headcount, which we have right now. As you can see, we've been trending down with that. We work with our divisions and with the budget folks and state personnel to make sure we're adequately staffed in all our areas, and we look at consolidating positions where we can to be more effective and efficient. And we're open for any questions that the committee may have.
Questions? Dr. Brown, care to make a comment? This is more your field of expertise and your experience over the last 20 years in the legislature.
Well, thank you for being here. And I think one of the things, just a comment, I guess, that I want to drill down on as we get into Ways and Means is the Tobacco Master Settlement and some of the programs. Some of the programs are through FSSA and not the Department of Health, so I know you don't get all the money, but some of the programs have been put in place when we first started the settlement, over a decade ago, and whether they're effective or we could redirect or reprioritize where we spend those money. So maybe a comment that we continue to look at that, and we'll have a hearing and Ways and Means on that.
Certainly appreciate that, and that's a priority of ours, again, is to look at that and find out what works. We know that the Quit line is working very well, and we want to emphasize that. We know Baby and Me Tobacco Free works well to keep pregnant moms from smoking. We're going to work on that. And Joe, did you want to comment on?
Right. We're going to, by the time Ways and Means comes around, we'll have a breakout for you of all our tobacco-funded programs, basically tell you what we're funding from them and what personnel we're covering from them or what subrecipients and programs. We'll have that prepared for you when House Ways and Means comes around.
Any other questions? Okay. Well, Dr. Adams, we're really pleased to have you on the team, and we look forward to working with you. And Joe, I expect you to keep him within the curbs on the financial issues.
He's a great boss to work for.
Thank you all very much, and again, please reach out to me with any concerns or questions. I'm here for you all and for your constituents, so have a great day.
All right, thank you.
Eric, see, I haven't seen say hi. How you doing? But let him sit there. I'll sit here, Aaron, sit here.
Our next presenter is the Department of Corrections, and we have Bruce Lemon, who is the commissioner, and several people to assist him in making this presentation. The Budget Committee did take a visit to Michigan City during this last interim and get a chance to visit that facility, and that was a pretty enlightening experience for us. And it also, I think, was enlightening to all the Budget Committee members, just as a realization of just how tough that job can be. And so we thank you, and we thank the department, and we thank not only the supervisors in the department, but all of the employees in the department, because we know that this is just not an easy job to have. And what we did see was encouraging in terms of the performance and the morale of the employees and the condition of the prisoners, which needs to be respected. So with that, we'll let you begin your budget presentation, and we look forward to hearing from you on your request.
Thank you, Chair Kinley, and thank you, Joint Committee, for allowing us to present our budget for 2016-2017. I have a few guests with me today that will be helping with the presentation. Aaron Garner, to my right, is our director. I'm sorry. Wrong. It is. Okay. They changed seats on me. This is Andy Pritchard. He's our Chief Financial Officer. Aaron Garner, Director of Research and Planning. Randy Kester is our Chief of Staff for the department. We have a few people sitting in the back that are also with us today. Jim Basinger, Director or Deputy Commissioner of Operations. Kevin Orm, Director of Construction Services, who most of you know. And Chris Blessinger is the Director of the Juvenile Services Division. So they will be helping with the presentation. I think we have a PowerPoint presentation for you, but we also provided a pamphlet. You'll see on the first page our mission and vision. That has not changed. The Department of Correction has over 6,100 employees, boots on the ground, and we have over 29,200 offenders that are incarcerated with us at this time. If you look at the map that shows our facilities, we have 17 adult facilities, and we have 3 female facilities in the state of Indiana, and as you can see, they're scattered all over the state. You'll notice they're numbered 1, 2, and 3. 1 designates a minimum security facility, 2 is a medium security facility, and 3 is a maximum security facility. You'll notice we have 3 female facilities. One's at Rockville, and we also have our intake unit at that facility. We have the women's prison here in Marion County, and we have Madison Correctional Facility for females in the southern part of the state. You notice on the juvenile facility map, we have 4 male facilities and 1 female facility. We have 2 male facilities in Logansport. One's an intake unit, and one is located at the Logansport State Hospital. We have a unit there. We also have Camp Summit in LaPorte County, and we also have Madison Juvenile Facility located on the grounds of Madison State Hospital. We have 10 parole districts in the state of Indiana. Recently, we expanded Bloomington, and we divided Bloomington into 2, and we added a extra parole district at Madison. That was done with no additional cost. That was done at the State Hospital at Madison to find office space. We did that for efficiency purposes to allow parole agents to work closer to their home without traveling so far to their home office. And that's worked out extremely well. We have about 130 parole agents that provide supervision. Parolees are use a risk assessment, their IRASC risk assessment, and we measure them according to risk, either low, high, or medium risk assessment. And I believe at this time I'll turn it over to Aaron Garner, who will talk to us about the population forecast.
Thank you, Commissioner. Good morning, members of the committee. The graph you see in front of you on page 5 is a historical trend of the total number of offenders that are sentenced to the Department of Correction as of the end of each calendar year, so a 12/31 snapshot of all the offenders. What you can clearly see there is dating back to 1987, and each year leading up to about 2009, the department's population has increased at about 4% per year. Mid-year 2010, our population did stabilize for a few years, leading up to beginning of 2013 when we started to realize an increase in our overall population yet once again. Around July 1st of this year, when House Bill 1006 became effective, we have started to experience a decrease in our prison population. That was fully expected, primarily in part because of Indiana Code 3538-3-3, which states currently for felony offenders convicted of a level 6 felony with 90 days or less to serve, they are no longer allowed to come to the Department of Correction. So that's been the primary reason why we've seen a decrease in our population of about 600 offenders since July 1. Further, come July 1 of 2015, that number changes to 365 days or less to serve. For those same felony 6 offenders, those offenders are no longer allowed to come to the department. So yet, even further, we expect that we will see an additional decrease in our population for the next few years. And with that said, I would turn you to page 6 here, which is our population projection forecast through 2019. As I just mentioned, you can see starting in July of 2015 through about the end of 2016, our prison population is expected to decrease, and that's represented on the graph with the red bars there.
Thank you. Yeah, so how did we get an increase when the numbers are showing a decrease? I mean, what are these projections based on?
Our population projections are historically based on admissions to the Department of Correction. These right here took into account all the changes that became law when 1006 was put into place on July 1. So what we're seeing is actually a decrease leading up to about 2016, primarily because of those level 6 offenders that are no longer allowed to come to the department.
So you're only projecting a decrease through 2016, even though the felony number of days is going to go to a year in a year from now?
That is correct. And that is due primarily because the rest of the offenders that will still be coming to the department are actually going to serve a longer portion of time. The serve 3 days, get 1 day of credit, or
Right.
the 75%.
So and the reason I'm asking you this is because over the last couple of years, as you know, we've had a big, I don't want to say fight, but we've had a lot of differing opinions about these projections. So I'm trying to figure out, did you guys do these? DOC did these?
Yes.
I'm trying to figure out what assumptions you're using to make these projections. In other words, you know, are you assuming, what are you assuming the sentencing levels are going to be to get you to these projections?
Sure. So as it currently stands, we basically are taking the middle road. So we're putting some offenders at the advisory under the 1006 sentences, and then projecting what their release date would be. And then some offenders were also taking historical sentencing levels and using that to base what their projected release date would be. And until we get a better feel for what actual sentencing practices are going to be under the new law, that's basically the stance we have taken throughout this entire endeavor. And once we get a better feel for what sentencing practices are going to look like, in theory, we could adjust those population projections. But that is our assumption right now, is that half will be sentenced about the same way they always were. Half will be sentenced near the advisory of the new 1006 felony level.
So you're saying, that's the other thing. So you're saying you're figuring half based on current levels, half based on the new advisories. And that's what you're, and then keeping the number of offenders kind of constant? Did you do a cost of living, did you a yearly inflation adjustment, or,
So, yeah, we take historical admissions and we assume that historical admissions are going to carry forward as the projections are plotted out here. We do take out-
historical admissions meaning, you know, for those various levels?
Correct.
Okay.
The offender was no longer allowed to come to the department, so say the 365.
So those guys are all out.
Those guys are all out. A good example might be a level 5 offender. A level 5 offender is commonly referred to from the old code as a C felon, right? So an advisory sentence on a C felon was 4 years. If they served 50%, they would do 2. Well, under 1006, a level 5 offender carries an advisory of 3 years. At 75%, that's actually 2.25 years. So even though 3 months doesn't sound like a lot of additional time, those types of offenders stay, even ever so slightly, just a little bit longer. And over time, those admissions start to stack up on top of each other. So as you see later on in the graph, that's why we actually expect to experience an increase in our prison population. And if I may, that's a good segue for me to jump to slide 7, which is really...
Yes, Representative Gooden had a question.
Thank you, Mr. Chairman. I understand these projections are projections. That's what they are. There's no way I know you're trying to answer the question the best you could. But probably the best question would be, or the best answer I'd like to have, you don't have to do it now, but of those, the decrease in population you're seeing at the state level, would it be fair to say that that would equate to the exact increase at the local level then? Because these people aren't going to the state anymore. They're going to be staying at the local level. Would that be a fair assumption to say then that the local prison or jail population is going to increase because those folks aren't going to go to the DOC?
I think that's fair to say, assuming that the same number of convictions hold true year after year. You're right.
I think maybe we're going with this is there's not going to be fewer criminals. They're just going to be housed in a different place, is what we're saying.
Yes, those lower
And then as we go along, I've got 2 other questions here, but let me hold off on those because I think you're going to touch base on those, and I'll ask those at the time we're going to do that. So,
Yes,
thank you.
Budget Director Bailey has a question.
Aaron, there was a vendor that was retained by a legislative committee, I think in 2013, that did a study on population projections to try to see where there was difference between population projections with DOC and with LSA. Can you talk about where that vendor ARS came down in terms of the population projection?
I believe their population projections were somewhat closely in line with the departments. They did show an increase in the overall prison population, but I don't know that they revised their population projections, or at least I did not see a report after some of the final changes of 1006 were put into effect near the end of session last year. But we did work closely with that firm in providing data, and I may point you back to.
Before you go on page 6, the black line is your capacity number, and I may have missed this. Did you explain why you're lowering your capacity?
Did not explain that, but I surely can. So what we're expecting to happen, and when you see the decrease, and I'll flip back for you there, is that right now the department has about 1,300 jail beds available to us, and our expectation that would be that as some of those lower level 365-day offenders are kept locally, that may take up that additional capacity that we've been relying upon for the past year. So as more offenders stay locally, we expect that that's less capacity available to us in those county jail beds.
So in your capacity, you include the county beds.
We include beds that are essentially reserved for DOC offenders.
Okay, but you keep them there in the counties as part of your housing complex, is that right? I'm just trying to make sure I'm with you. And so this does not represent, for example, the closing of a prison. It just means that you expect to have fewer local beds available in your inventory.
Correct.
Okay, Representative Gooden, did you want to pick up on this?
Up a little bit with what you're saying there, Senator Kenley. Thanks for the opportunity. And as we move through the legislative session and we start talking about budgets with the DOC and costs, I think we really need to be very, very sensitive to the local needs as well, because what we've done is here, last couple of years, we've been very good at pushing our costs state level down to the locals. And with the property tax caps, the county commissioners that make up District 66 have made a joint effort to get to me and say, hey, we can't absorb any more costs. You're pushing all this back to us, and you've capped us on the amount of money we can raise, and we just can't do it anymore. So I think we need to be very, very careful about that, because as you pointed out, there's not going to be fewer criminals. It's just that the locals are going to be responsible for them now, not the state. And then if you're renting, and you're actually going to be renting beds from the point to Representative Kenley's question is, the state actually rents beds from the county jails, and then you guys consider that a part of your system with that rental of those beds. So as we move forward, we need to keep this all in the big picture, and then we talk about the privatization part. I notice you've got some requests here with that, but when we get to that, we'll get to that when you get to that. So, thank you.
And then this has, in the bottom box, it has the plan for new secured cell house at Miami and also at Wabash Valley. And so are those costs contained within your budget request for those expansions?
We have a change package in here for operational.
Okay.
I believe our capital also
And we'll
reflects that.
cover that later, I assume. Okay.
So as you mentioned, Chair, the focus on page 7 is a subset of what we've been talking about. So the illustration here on page 7 is specific to adult male offenders who are housed in our secure confinement, or commonly referred to as our medium and maximum security offenders. These, of course, as you know, are murderers. They're A and B felons. They're a large portion of C felons. We have historically known them. Moving forward with 1006, those are going to be your level 1 through 4 offenders, and a big portion of the level 5 offenders. So that equals about 80% of our existing population now, and that number has continued to increase ever so slightly over time. Those types of offenders were at about 95% capacity as it currently stands. Those aren't the offenders that were expected to be diverted at a high level because of 1006. So here's really where the pendulum starts to swing potentially, and the truth in sentencing aspect of 1006 may come into play, or that 75%. And that really is what these numbers are precipitated upon, is that the 75% offenders are going to start serving a little bit longer, and then that stacking effect that I mentioned earlier is really going to kick in starting the tail end of 2016, and we expect to eclipse our secure confinement capacity somewhere between January and April of 2017, which leads us to that first housing unit request at the Miami Correctional Facility, illustrated on the graph by the star with the number 1 above it. And then you'll see that each subsequent star represented there is defined down in that bottom leftmost legend there of it, up to 5 additional housing units that are going to be needed for secure celled environments for those medium and maximum security type offenders that are staying a bit longer with us. With that said, I'm going to hand it off to Chief of Staff Custer.
Thank you, Aaron. Members of the committee, the Department of Correction could not operate in a vacuum. There are a lot of other stakeholders that we partner with that provide sentencing options in addition to prison. Prison is really reserved for the most dangerous and the worst of the worst. The other sentencing options available to judges, depending on the nature of the case, include, and we've already mentioned several of them, jails, community corrections, probation, and I would include a subset of both community corrections and probation, and these are specialized diversion programs. We have, not only do we have prosecutor diversion programs and court diversion programs, but we also have a statutory framework for forensic diversion programs. And those are the other options that are available to sentencing courts. We have a direct relationship. We partner with all of them, but we have a very direct partnership with jails and community corrections because some of their funding passes through the Department of Correction. So I'd like to talk to you about kind of the current state of affairs on our partnership with those two entities in particular. On page 8 of your book, this shows a snapshot. We've already mentioned the county jail holds. We do have that partnership, and you can see that for the months of the last 2 years, though they fluctuate from month to month, they really stay between about 1,100 and 1,300 DOC people incarcerated in county jails that we pay $35 a day for. I will add, we mentioned 1006. 1006 has a provision in which there are certain people restricted. Right now, it's those serving less than 90 days. Someone already mentioned correctly that changes July 1st to those serving less than 365 days that are level 6 that are sentenced to county jails. They will also qualify for the $35 per diem. Right now, it's 90 days, and really, those are the kind of people that are diverted naturally through the community correction programs we've got now and through jails. But it is going up. Right now, in addition to the 1,121 you see at December, there's another 156 people that are not sentenced to the Department of Correction, but are sentenced directly to jail, but that we're paying for under the $35 per diem because of 1006. I expect that number to continue to increase. It started in August with 2 people, then it went to a dozen and a couple dozen. Last month it was 128, and so far this month it's 156. That'll continue to go up. And as that goes up, I think that these discretionary holds will go down, and that's what was reflected in Aaron's numbers, and that's why you see the capacity going down.
Okay, Representative Clinker and then Senator Italian.
Chairman, gentlemen, when you transfer them, do they go into community corrections or do they stay in the local jails? Do you have a program for them that leads to work or community corrections so that they can make their own way in many instances?
The ones that are in jails, that stay in jails, the ones that right now that you see reflected on the bar chart, those are ones that are sentenced to the Department of Correction. And do we have programming available in jails as much as we do in prison facilities? Not as much. There are some jails that we do operate programs in, and they work very well with us. But frankly, the $35, it really depends on the sheriff, the jail commander, and the staff of the jail about what kind of programming is available and what kind of space they have in the jail and things like that.
Are you finding that it's reducing recidivism? And do you have to send any of those folks back into the regular prison system in the state?
I think the answer is where there's programming, we see an effect on recidivism. It is reducing recidivism, but we do see some of these people go back to prison. Yeah.
What would you say the percentage would be?
I have to get that for you, Representative Clinton.
Okay, then Senator Italian.
Just explain this to me because I'm not sure if I have this down. The people under 1006 who are sentenced to less than 90 days and then less than 365, are they sentenced as level 6 to DOC, but they just can't go there? Or are they sentenced to the county?
They are not sentenced, they are prevented by 1006 from going to prison, so they're sentenced to one of the local options I mentioned.
Okay, so this is the part that I'm not getting. The people that are currently under doing less than 90 days are in county, and they're getting the $35 a day. But the next, then you mentioned a group that's going to get bigger.
That group.
Yeah, explain that. I didn't quite get
And
it.
it is confusing, because Indiana's never done anything like this before, so it's all new. But those people who are restricted from going to prison, those are level 6 people currently that are with less than 90 days to serve. If they're sentenced to jail, then they qualify for the $35 jail per diem. I say $35 because that's the number stated in the budget bill. It's subject to change, but it's been $35 for a long time. And they're subject to that. They get that. So it's a little different because we're looking at people. This reflects only those who are sentenced to the Department of Correction, but we're going to start we're going to have to create another bar chart and show those who we pay for that aren't sentenced to the Department of Correction, but kept in jail.
That's what I was trying to figure out. So now one more thing, just to follow up on Representative Klinker. In your projections of where this is going with how many people are physically in the county jail, in your projections, have you figured in any additional money or for community corrections that will get people physically out of the jail? Is that part of your projections?
We have projections. It's not part of our change package. Our change package right now is just really the base change package for DOC to operate as it always has been.
As it has, okay.
You answer a good question. I think I can answer a little bit more of that question later on. I think
Okay, I'll wait.
I think you asked a very good question. The next page, we turn to community corrections. And I've got to say, and I really can't say enough about community corrections in the state of Indiana. I think Indiana has something to boast with its community correction program. We have a very thriving and productive community correction program in Indiana. It would be one of the best in the country. And if you look at the map of Indiana on page 9, there's a lot on this map. It shows which counties participate in community corrections, which ones are in the process of becoming participating counties. Community corrections is not a mandate. Counties do this if they want to do this, and they create advisory boards locally, and they pass a referendum that says that they want to be a participating county, and then they'll make a grant request from the Department of Correction. And so that kind of shows you the state of where we are in Indiana up to date on page 9. Page 10 shows the growth of community correction. And I've got to confess that it's already inaccurate. We show 85 people in 2013 and 14, and just a day before yesterday, Kosciuszko County fulfilled everything they need to do to participate, and it's just a matter of them. They've already made a request, and the request will be granted, and they'll be the 86th participating county. So it does continue to grow, and we have a few other counties that are also going through the process of being added. And our goal, of course, is to have all 92 counties added at someday.
They're Italian.
That extra money that we put in the last budget, I think it was 10 for community corrections. Did that money all get out?
I don't know how much we have left. I can tell you most of it has been dispersed, but yeah.
Okay, all right.
Some of it is to bring new counties on. Some of it is to increase the base of current counties that just needed right-sized.
Right, no, I just wanted to know. It's all out, and they're asking for more.
Yes, they are.
Okay.
Page 11, I'd be remiss if I didn't touch on, and this is, it could be called back-end diversion. Community Transition Program is a statutory scheme in which sentencing courts take another look toward the end of a person's sentence based on their felony class. They take a look and will report about their progress, and they'll decide whether they should be stepped down back to the community a little bit early. The statute kind of sets out a framework depending on felony class of how early. It's 60, 90, 120 days early, depending on felony class. And this shows you the participation rates in that. And really, it's been hovering around 1 out of 4 of the qualified people get approved for community transition. That's also paid out of community correction funds.
So how many people are going through at any given time the community what does that represent in terms of a whole number?
I can give you the exact number, Chair Kenley. It's going to be 500 or 600. It's going to be in that range at any given time. As ones complete their sentence and fall off, other ones are added to it.
So I know that we were trying to get to 1,000 at one point in time, and then what happens is everybody's got a new program or a new idea for you, and so it's pretty hard to focus on everything. I guess, and you don't have to answer this today, but I guess the question is the program justifiable, workable? Are there other steps that need to be taken? For example, we've got a new Chief Justice. Sometimes a review and a retraining session with all the judges to talk to them about why this is there and what it can do for us. Well, just that alone will help it be used if it's an appropriate and a good thing to do, see? And you've worked with me on this for a long time, so you have some answers to those questions.
I think the quick answer, Senator, is that it is a good thing in the proper case, and we have good cases. We're doing more work directly with sentencing courts. An example would be purposeful incarceration. That's what we call it. And it's really case management at the time of sentencing. It's when a court looks at someone, and an example would be if someone has substance abuse problems, and that's the core of the criminality, they could be assigned to a purposeful incarceration program, and we would put them right into a therapeutic community treatment model. And the court would look at the progress of that person, and if they're making good progress when they complete that program, the court often would use something like a CTP to step them back down into the county through community corrections. And in those kind of models, that works very, very well.
It would be a shame on this program and any other program that if you have, and this is actually directed at you, Bruce, if there are programs that we need to reinforce, for example, with the Chief Justice and the courts, that how we manage and do these things. Chairman Brown and I, everybody's paying attention to us right now until they get their budget, and then once they get their budget, then they won't be back for 2 years to worry about us, So we need to make sure that we make the things work that we can work, and this is one in particular. Clearly, the concept is a viable and usable concept. It's just a question of whether the courts will go along with it and use it, and it's totally voluntary with them. So we need for you to use this time to come to us and say, probably be a good thing if you sat down with the Chief Justice and we tried to have a retraining session with all the judges,
We'll provide a report back on that.
Yeah, let's just talk about those things. We need to use this exercise as a way to improve ourselves overall.
And then the last information about community corrections, 2 pie charts. I think both of these are pretty telling and answer questions that are often asked. The first one has to do with the kind of programming. What we did is take the programming offered in all the participating counties, we kind of lumped them together and then broke them down by percentage so you can see what the programs consist of mostly. And on average, most of it is work release and home detention with electronic monitoring. Those are the 2 big programs that are most often and probably always offered, except, I should say, work release. Work release is really growing in community corrections. This is another very viable option in counties that have residential work release. That's another alternative to jails. It's another alternative to prison because it does offer a residential and at least a semi-secured environment where people go to work during the day and they can come back and be supervised in the evening. For the right case, that's also a very good evidence-based model when it works. And then it shows the other kind of alternatives that are offered throughout the state. The bottom graph has to do with funding of the community correction programs in the aggregate. The state, this is a grant fund. This is different than the jails. The jails are per diem. This is grant funded. And the state really funds about 47% of the statewide costs of community correction. Project income, and this is mostly user fees. These are participants paying a fee. An example would be electronic monitoring with home detention. Oftentimes they'll pay a daily fee for the electronic monitoring, home detention. Sometimes that covers most, if not all, the costs of that particular program. And then we got about 15%, I'd call that other. It says county match, that sometimes is county general fund. It also includes other kinds of grants other than just DOC community correction. It includes both local and federal and other kinds of grant opportunities that hardworking directors of community correction will find. And then it could include even some benevolent grants. So that kind of composes the other 15%. Just to answer your question, Senator, I mentioned several different groups, local groups that can help divert from the Department of Correction. We do have a budget for community corrections and for jails that's similar to our previous budget. I think the question revolves around 1006. Is it going to stay the same? We have a projection that if the 365-day language stays in and level 6s are prohibited from being sent to the Department of Correction, using historical data, that would divert 3,828 felons from admissions to the Department of Correction. Now, I need to explain that. That's not yearly beds. These are people serving less than a year. Some of them are serving significantly less than a year. So it takes 4 people serving 90 days to equal 1 person serving a year. So we call that full-time equivalent. So that 3,828 has a full-time equivalent of 1,443 beds. That's how many, and that's what's incorporated into Aaron's projection numbers. That's how many beds, full-time beds, that the locals would have to have ready if 1006 stays the way it is. I should add on top of that, 1006 also opens up language for what I would call discretionary, case-by-case discretionary calls. This is what's restricted by statute. We know this number. The court can also increase the number of diversions on its own. And it's hard to gauge what that change would be, but they can also do that. And again, do they go to jails? Do they go to community corrections? Do they go to probation? Do they go to forensic diversion? Those are questions that really are hard for Department of Correction to sit here and answer in the future. And with that, we go to the change package portion, and I'll turn it over to the CFO.
Thank you, Chief. Good morning. I'm Andy Pritchard. I'm the CFO. Our first change package is basically requesting a reinstatement of our fiscal year 15 appropriation. We expect to expend our entire appropriation on operations. I might back up just a little bit. I think it's an excellent fiscal story that DOC has to tell. Over the last 5 years, our population has grown over 20%, while our appropriation for operations have remained flat. I think we're the only DOC in the country at this point in time that actually have lowered our per diem, which is our average cost per day for an offender. It's a very successful fiscal story. The DOC has been a very good partner, fiscal partner, in contributing to the state's current financial situation, stability. However, some of the low-hanging fruit, the same year's cost savings initiatives are pretty much gone. We, at this point in time, actually appreciate the opportunity to right-size some of our custody staff. You'll see in change package number 5 and number 6. We call that a right-sizing of our custody staff, both to get our levels back to what we call appropriate levels, as well as fund staffing necessary to meet the federal court mandates on mental health initiative. With that, I'll move to change package number 2. This is fairly straightforward, and it's pretty much one we bring. We have 3 major contracts of which we need and contractually obligated to provide CPI increases for. The first is our medical services contract. We just recently completed an RFP with IDOA's assistance, very able assistance, I might add. We were able to lower our cost of our medical services. If you look, and you'll see that we've actually increasing price here about 2%, but even with the 2%, we'll be at pre-2012 spending levels for our medical services. We think this is a real success story. Also, likewise, with our food service.
Is there discussion across the country among the DOCs about prisoners who are being fully paid for in their medical services, who are inmates who, if they were in a hospital setting, would be Medicaid eligible, but they're not because they're in a restricted or incarcerated environment. Is there any discussion across the country that talks about how some of those individuals could be selected and put in a different setting, and then the Medicaid program would pick them up? Or where is that discussion?
There's considerable discussion with regard to Medicaid and the applicability toward our offenders. I might remind this group, because I know you were part of it, you passed a Medicare Plus 4 cap some years ago, and this has been extremely cost-effective for the DOC in the state.
Right.
That actually, Medicare Plus 4% is very close to the Medicaid rate. So most of the savings related to the Medicaid rate is being captured already with our Medicare Plus.
Okay.
Going forward with the Medicaid, the federal matching program is what's available.
Okay.
We've already achieved about 50% of what most other states when they're moving this way. There's been considerable effect. We have a new process starting with FSSA and our medical provider and ourselves to get our historically eligible offenders. And on a historical basis, we're allowed to have retroactive care. In other words, we can identify those offenders who've spent over 24 hours who qualify for Medicaid, applied, and processed. Those savings are close to $1.5 million to $2 million a year. That process is just getting started December 17th, 2 days. So that process is
Have you calculated that potential into the budget request, or did you leave that as a set aside until you know for sure?
Actually, what we did was, as part of the medical care cost, we were able to negotiate the savings to go back to our medical provider, and we've achieved those savings
Okay.
100% through our per diem, our medical cost per diem. So at this point in time, it has been included, yes.
Okay.
Food service, we've just negotiated an extension of our current contract with very favorable terms. My favorite is, as a CFO, is the cap on future increases. The CPI increases have been capped over the next 6 years. Makes it very determinable exactly what we will spend. In fact, those caps are well below what we think will be market CPA on CPI. Last one is we have a private contractor running 2 facilities, our Newcastle facility and our newly named Heritage Trails. Those contracts will increase by 2% per contract terms.
Oh, Representative Gooden, I'm sorry.
You're talking about the 2% increase in the contract. Has that been on the private facilities, was that a negotiated cost increase contractually, or is that just an automatic built-in increase? Or
It's within the contract, and it's as negotiated with the original contract, yes.
okay, how's that determined as a 2% as compared to 1% or 3%? Is there
It was
a range, or is
it
that just
was-
what it was?
It was put in original. That was what was done. I don't know how many years Newcastle's been in place, but it's been 7 or 8 years.
All right. I noticed that in your handouts, it increased the number of dollars going to Newcastle, almost $1 million. Is that what that's going for then? Is the increase in?
That's exactly what that is.
Okay. All right. Thank you.
It's still a very favorable price for us
Okay.
on a daily basis.
All right. Thanks. Thanks, Mr. Chairman.
Change package number 3 deals with what Director Garner was talking about, based on a projection of population increasing, that we expect to have to build some cell houses in this coming biennium. As such, we're asking for the custody staff, some .1 available to us to be able to fund the operation of those new cell houses. Change package 4 is actually something that's needs to be corrected. What we've used very successfully is energy savings, energy guaranteed savings contracts, performance contracts, to great effect. We have been able to use this unique financing to basically improve the operations of our oldest and leakiest facilities. The financing for those improvements are designed to come out of the savings that are created. In practice, what should have happened and did not take place was we should have kept our appropriation for utilities at those pre-improvement levels. I tell you today, we've studied it, we are getting the savings. In fact, case in point, last year, with as cold as last winter was, last year was the lowest money, lowest amount of money we spent for utilities in the DOC's recent history.
That's a fairly impressive statement. So if you're asking for a change, for an increase here, does that mean that, I'm confused, if you,
2005, when we started this, we've seen our utilities go down.
right?
We've not kept the appropriation at that higher level. In other
Okay.
words, we've just set those appropriations lower and lower.
Right?
What happens is we have a payment we make to the financing for those things.
Right.
That should have come out of that same account, out of those savings.
Okay,
They didn't. We've been absorbing those within our operations.
okay.
We're to the point now, we're, we can't absorb those expenses any longer. We're
You agree with all that, Kevin?
I do, sir.
Okay. All right, Representative Gooden.
Probably the only place in Indiana where we can say we're saving money by spending more money because we're saving money money we didn't spend because we're going to spend it later. But if that makes it, I understand your point. At what point is the DOC going to ask the governor to stop asking for reversions then, back to the general fund? Because let's put it all aside. This is the realistic part. You can only put a patch on the tire so many times, and you can only go to so many places to find this graft or this whatever, this efficiency in government. And you've just, without telling us, you've told us where this efficiency has been coming from. And now you're coming back and asking us for that money because you don't have the money to be able to continue that. And I'm not chastising you at all. I'm just pointing something out here, okay? Don't think I'm jumping on you. I'm on your side on this, okay? But so this, all this comes to that point is at some point there's no more savings and you got to move forward. And that's why I was being facetious saying the savings is going to cost us money because it is. Now, it's a short-term savings 2 or 3 years ago when they were begging us money back and telling you to send it back. But now, up front, you're going to have to re-up, and it's going to cost more in the long run. But you don't have to comment on it. I'm just saying, hey, at some point, you've done all you can do, and you got to say stop.
We think we know who you're pointing the finger at, Representative Gooden. So.
Well, in response, change package 5 and 6 are both funding that's being made available for us to right size and get us to a point with staff that we can meet mandates from the federal court on mental health, as well as run our staffing levels at appropriate levels for public safety purposes.
Okay, so you put it on the table pretty clearly. We've all got a challenge to deal with here. That challenge is going to be kind of controlled by the revenues that we get over the next couple of years, so we're all going to have to work together to fix it. Are there other questions? Thank you, gentlemen, for your presentation and for the good work that you do.
Thank you, sir. Thank you.
Yes, Representative Gooden.
This is on the record off. I want to say thanks for your response. I know I contact little Timmy over here a lot of the times. And as a matter of fact, the gentleman, he calls me back at night after hours and all that. So I know he's working his tail off. So thanks for all you guys do. I know it's tough out there. So thank you.
Thank you.
Okay. Almost on schedule, David.
4 minutes, you're doing well.
Yeah. Got off to a kind of a rough start this morning. I don't know, Brian, did you ask for a pay raise for yourself? I think your job's getting harder. Okay, we're going to go ahead and call the business portion of the meeting to order. The minutes of the last meeting have been distributed, and I would ask if there are any amendments to the minutes.
Move approval of minutes, October 17th.
Okay, all in favor of the minutes as submitted, please signify by saying aye. Aye. Any opposed? Thank you. And then we have a proposed agenda that's been distributed and released to the public. So are there any amendments to the proposed agenda? Okay, seeing none, we will proceed with the agenda. And first item on the agenda are to deal with the agency projects. And we have Mike Smith from the DNR. Mike, let's see, I don't know if I should make this announcement or not. We do have a Christmas party scheduled on the conclusion of this meeting, and lunch will be served. So I know that we'll all be as expeditious as we can, but this is a little bit meatier agenda than we thought we were going to have. So I do think that this is an important time to have a thorough discussion. So if anybody has any questions or anything that they do want to take a little time on, I think we need to respect that request. So Mike, start us out.
Good morning.
Morning.
DNR has 3 projects on the agenda this morning. The first being the Division of Nature Preserves is requesting funding for labor to support public access and visitor safety along 67 trail structures at 25 locations across the state.
Mike, let's do this in an effort to help and get down to the focus where people do have questions. All the members have received the list of these agendas, so let's just ask if with respect to the DNR, do any members have any questions on any of these items that have come to your thought or attention? Yes, Representative Gooden.
I thoroughly reviewed the items. I have no questions, and we can move forward. So,
Okay.
if that's okay with you.
Mike, is there anything with respect to any of these items that you think is not contained in the briefing sheets that we have here that you would like to advise us about?
Chairman.
I think you're good. You're taking advantage of that opportunity. All right, let's go on to item number 4 then. Thank you, Mike. And we have the Indiana State Museum, and we have Tom King here with us. And this is a request for $2 million. And Tom, I would like for you to explain in your own words how you came to be where you are. I'm going to commend you for doing a tremendous job. I never would have believed, when we did this, I thought this is going to come back and we're going to have to appropriate all this money that supposedly they're going to raise out there. And you've done an incredible job. And I think maybe some of the credit goes to the quality of our Indiana State Museum and how good it is for you to be able to do this. So I'm really pleased to hear this. And explain to us what's happened here and what you're asking for today.
The request is for $2 million, which the Indiana General Assembly approved in the last session of the last session as a part of a capital campaign to get the Indiana State Museum, the state historic sites up to speed, primarily for the bicentennial, but probably more importantly for the decade to follow that. Armed with the $2 million matching gift our grant that came from the Indiana General Assembly, we went out into the private sector, and to date we've raised $12.7 million toward the $15.7 million goal, and are anticipating another $3 to $4 million in gifts right after the first of the year when some of the philanthropic world meets. So yeah, it's been well received. I would congratulate both the House and the Senate for their confidence in us in the first place, because it was that initial $2 million matching gifts that I was able to go to the private sector and say, look, the state has some skin in the game. They want to have a good state museum. Does the private sector want to help? And so they stepped up.
Well, how much did you raise from the private sector, Tom?
We've raised $8 million to date from the private sector. Was another $1.9 million that was grants from the federal government for the Levi Coffin, and then the rest of it, the other 12, or the other
2 million toward the 12.7 would be this match from the state.
Okay. Questions for Tom? Yes, Senator Talion.
Just a quick question, because I'm a little unclear. Are you getting 2 million from Bicentennial and the general funds matching, or you're asking for 2 million total?
This was a $2 million matching gift that was, it's not for the Bicentennial, it's for the Indiana State Museum and Historic Sites.
Oh, all right, because this thing says Bicentennial match, that's why I was.
It was
So
called a
it's-
Bicentennial match because there wasn't anything on the books for Bicentennial at the time.
Okay, never mind.
Okay. Yes, Representative Clinker.
Chairman. Tom, I just want to compliment you on your latest magazine about the mastodons and everything else that you're doing there. It was very interesting. I couldn't put it down.
Yeah.
And sometimes, state museums, in some people's minds, tend to be boring. William Forsythe and all the other articles you had were very compelling. Thank you for sending that.
Thank you. You know I didn't write that, though.
Okay.
And you didn't pay me to say that, I might add.
Any other questions for Tom? Thank you for coming, Tom. We have 2 items for the Kankakee River Basin Commission, and Jody Melton is going to present those. I think if any of you are here 30 years from now, you're still going to be reviewing items for the Kankakee River Basin Commission. So, pardon? Well, until it dries up, I don't think we're going to run out of projects. Gentlemen, is there anything specifically that you would like to add to the language that's been presented to the Budget Committee? Is the language accurate in what it is that you're requesting the money for?
The request is divided into 2 parts. One, there's a section near I-65,
Okay.
which we're doing. There's a lot of work going on. We've relied on some private farmers, but it's not going to hold. And so
Okay.
we're going to help the, and by the way, this is Chairman of the Kankakee River Basin Commission,
Okay.
Chris Knackle, who's
Thank you
the
for
county
coming.
surveyor. So we're helping them in a portion of land down there. And then there's a 10-mile stretch in Jasper County that's been patchwork for years. And it's being worked over by the Jasper County surveyor with the contractor. We're going to help pay for most of that. Secondly, there are several other smaller projects, some log jam removal, a couple levee projects. We partnered with the Marshall County Board of Commissioners and helped them purchase a house in Plymouth, which they were able to take down and save the taxpayers $250,000 in maintenance costs. So we partner the best we can, and we thank you for all the help that you've given us.
Any questions? Yes, Chairman Brown.
Thank you. Does the River Commission report to any state agency?
No, we are. We're considered a state agency.
Okay,
under
so
statute.
each river commission that we deal, don't we have 4 or 5 areas? They are each kind of their own independent
Correct.
agency out there that really, we don't coordinate, and isn't that Senator Kenley's, they don't coordinate, and so come back individually periodically.
That's an accurate description.
Thank you.
Other questions? Gentlemen, we thank you for the good work you're doing up there, and thank you for being available in case we had some questions, okay? Thank you for serving on the board. Next, we have General Umbarger, Marty Umbarger, with various capital project requests. And Marty, it's always better not to ask Marty what his requests are. But one of the reasons why it's better not to ask is that most of the time, whatever he requests, no matter what your initial opinion of it is that he delivers on the performance of what he does and what he conceives. And we had, of course, we had the situation over at Knightstown, which he did just a fabulous job on, and then down south at the name is, I'm slipping.
Muscatatuck.
Yeah, so we went through all of that, and so Marty has a request in front of us. Does anybody have any questions for Marty? And then secondly, Marty, is there anything you want to explain further than what we have here in the written digest. He's speechless for the first time in his life.
It's good to be silent.
Yeah.
I guess I would just say, I think you all know this is probably one of the last times I have the opportunity to be in front of this committee. And to Senator Kinley, it's been an honor to serve all of you as your Adjutant General for 11 years. And I want to thank you for your great support you've given to the men and women of the Indiana National Guard.
We are glad to do it. You're going to be a hard act to follow, and I know that not only have you done a good job of moving the Guard forward and supporting the Guard as they've have to be deployed. That's just been an outstanding kind of extra effort award of how we've tried to send them off properly and receive them back home properly. And I know that you've paid a lot of attention to that. So, and I know that the troops appreciate that, because I never hear anything except good comments about their leadership, and that's not always true in every military camp that you go to. So you've done a great job, and we appreciate it. Are there questions? Okay, thank you, and have a nice holiday. Okay, Jason Larson is here for the Indiana War Memorial Commission request.
Good morning.
Good morning, Jason. This is a little bit of a change, so why don't you just briefly tell us what your change is here, and then we'll see if anybody's got any questions about this.
In the budget, there are 3 different line items for work for the War Memorials Commission, and they include doors and windows, elevators, and fire suppression. During inspections of the Soldiers and Sailors Monument, we found some damaged components of the bronze work that wraps around the monument. That the bronze work's all still in place, but we have concerns about its ability to stay in place. So what we're wanting to do is reprioritize the funding, put it towards the bronze work to make sure that we don't have any failures there. We're not certain as to the extent until we get scaffolding put up around there. It's our intent that after the bronze work is completed, that we come back to ask to utilize the remaining funds back towards the original projects.
Okay. Anybody have any questions about this change of use here? I don't see any, Jason. Thank you for coming.
Appreciate it.
All right, and then on the agency projects, last we have Kevin Orm from the Department of Corrections, and he's got communication infrastructure upgrades. And so Kevin, what are your thoughts on this?
The summary is accurate and inclusive. The radio systems across the country are migrating to a P25 standard. Simply put, we have till September of this year to do the necessary upgrades, or handheld radios and our communication systems will be down. This is part of a federally mandated update.
Well, I know that I don't know enough about this to really know what's going on, but I got a little nervous when I saw this, because it seemed like for a while there we were talking about 800 megahertz issues all the time, and so hopefully we're on the right track here. Any questions from the committee members on this item? No? Okay. Thank you, Kevin. Good to see you again. And then the university projects, are they all Purdue? You know, Kevin, I tell you what.
We have 7 projects on your agenda.
Well, your president came in and made a very nice presentation about your next 2-year budget, and based on his dislike of capital projects when he was the governor, I almost feel like I should have made him come in here today. He knew which meeting to come to.
This list is shorter than we had last year. So.
It's shorter than last year. Well, you have a number of projects, and some of them are pretty standard in what they're doing. And let's first open it up for questions from any of the committee members on any of these projects to see what their thoughts are, and then we'll give you an opportunity to maybe to, if you think we need to have a little more information about some of this, I'll be glad for you to do that for us. So committee members, did you see anything as you read this that stimulated you enough? Yes. Senator Gooden, or I'm sorry, Representative Gooden, didn't mean to insult you.
I don't have any questions after that. I just want to say with the presentations of the president last week or whenever that was, and as we move forward, how important it is for our universities to continue to be competitive, not just in Indiana, obviously, but nationwide and now worldwide. So kudos to the universities as they move forward, and look forward to being a partner with them again as we
Thank you. I'll pass that along.
Chairman Brown.
Thank you, Senator Kinley. On the Forney Hall and the Honors College residency, is this part of the long-term plan to upgrade a lot of the existing residence halls, or I guess part of the plan with students and some of their particular interests, they don't want to be in residence halls, I think, or they want a new type of living. Are universities going to get out of the resident hall business long-term, or?
No, I think, in fact, the opposite is likely true, particularly for us at Purdue. There is the Honors College project here, which is a new residential facility that includes a significant academic component to the building as well. And then there's a restroom renovation for McCutcheon Hall, which is the second of the towers of that, so that we'll be halfway through the 4, what we call H halls, the high-rise towers. We have to maintain those in the current desirable condition, providing the amenities that students want. We know from our own academic experience on the students that students who live in university housing do better. They graduate and they stay with the university. And so we're going to make a concerted effort to increase the number of residential housing opportunities we provide for students on campus.
Yes, Representative Clinker.
Chairman. Kevin, just having been in some of those buildings, Forney Hall is one necessary place that needs to be having quite a bit of attention. There's been a fire there and some other things, so we're pleased that you're doing that. And you're right about campus living. Makes a big difference when you're on campus with other people going to class by 7:30 and getting work done. So I agree with you on that. Thank you.
Any other questions? Well, I'm sure that that's accurate about the value of campus living, and if you just had the courage to require everybody to be there the first year and then have a no car rule, you'd really have it under control.
Down on a lot of the parking issues that we have.
That's right.
Let me just say, Mr. Chairman, before I leave, that I want to thank you and the other members of the Budget Committee and those that have been involved in the legislative process over the years. We received new legislative authority this last time for a construction manager as contractor, known as CMC. And the Honors College project is the first project we will use that new authority for. We estimate that we have some significant savings as a result of using that new authority and that new process, because we've been able to incorporate the contractor into the design process. We're going to shave at least a year off of the construction, which saves us money. And by working with the contractor and the AE firm as a partnership, we've been able to also save some additional money. So we want to thank you for that new authority, as this is the first opportunity we've had to use that.
That's good to hear. I'm really pleased that that's working out, Kevin. Other questions? Thank you for coming today, Kevin. Let's turn to the review items. Kendra York is going to handle the first couple of items, and the first one would be the Motorsports Investment District. Kendra, good to see you again.
Hello. Dina, is the presentation loaded up on here? Do you know?
Yeah, what do you have to tell us here on that one?
Good morning. I have very good news for the members of the committee. So just to refresh everyone's recollection, we're here today, I'm here today requesting your review of this transaction. We have gotten to a very good place with the folks from the IMS on this deal. We have successfully negotiated a term sheet at this point, and so we wanted to get here before you and have you take a look. I've got some deal points we can go over and a kind of an overview of the structure of the deal, kind of where we ended up. So that's our purpose for being here this morning. So I think everyone should have the slides in front of them, hopefully. The first slide here, just quickly, kind of going through some of the deal milestones to date. In July of 2013, the statute obviously went into effect. In December of last year, the Motorsports Commission held its first meeting and the public hearing establishing the district. In January of last year, the admissions fee was implemented. And in November of this year, the Department of Revenue established the 2012 base and 2013 incremental income and sales tax amounts for the district. And then here we are here today requesting your review of the transaction. Slide 3 has a kind of overview of the district itself. As you can see here in blue, that's actually the district boundary, so you can kind of see how that lays on top of the Indianapolis Motor Speedway property there. The outline in red are the parcel boundaries for that area. Turning to the next slide, just a reminder, the district does contain 103 parcels, which fall into one of 3 categories as prescribed by the statute. They qualified motorsports facility, which is obviously the IMS, adjacent property that is both related to operations of the IMS and owned by the IMS or its subsidiaries or affiliates. And then lastly, property on which activities related to the IMS occur. So those are the kind of 3 types of parcels that were pulled into the district. The next slide has sort of an overview of the deal itself. The IFA will issue the bonds. The net proceeds of the bonds will be used to finance facility improvements at the IMS. The IMC will pay lease rentals for the project to the IFA in an amount sufficient to pay the debt service on the bonds. And such lease rentals will be payable by the Motorsports Commission from a state appropriation, which shall be requested in an amount of $7 million annually for the 20 years that the bonds will be outstanding. That appropriation will be held in the Motorsports Investment District Fund until the payments are made to the bondholders. The IMC, the Motorsports Commission, IMS, and the IFA will enter into a development agreement with respect to the project, and the statutory requirements, including the annual payment of $2 million by the IMS, will be paid into this Motorsports Facility Fund, and there will be a guarantee by Holman and Company. IMC, IMS, and IFA will enter into leases and subleases of the project. The bond term will not exceed 20 years, and annual debt service on the bonds will not exceed $7 million, again, to tie back to the annual appropriation amount of $7 million. So we got to keep the debt service under that $7 million appropriation amount. Again, admission fees, incremental sales, and income taxes within the district are captured for the 30-year statutory period and credited against the state appropriation that are used to fund the debt service.
So why do we have a 30-year capture and a 20-year bond?
To ensure that we have sufficient taxes captured to repay the state for the appropriation.
So is it going to take 30 years to do that, or is that?
It depends on how the taxes come in. We don't think it will, but we want to have that protection there just in case.
So if it doesn't take that, then is the transaction going to close down?
That's right.
Okay.
Yep.
And then do you have an estimate on what the net proceeds of the bond are going to be?
We do. As of right now, we're looking at between 80 and 90 million, kind of depending on where market rates end up. We're looking at net proceeds between 80 and 90 million.
And this is for a $7 million payment for 20 years.
Yep. That last bullet on this slide is an important one that I want to make sure we hit. The makeup of any shortfall at the end of the 30 years between the credits and the state appropriation is guaranteed by Holman and Company. So we do have a parent guarantee in the event that facts don't end up the way Senator Kinley just alluded to, where the taxes are sufficient to make the state whole. We do have a parent guarantee from Holman and Company to make the state whole in the event that that were to occur.
And so just to pull this together a little bit, on the second or third page there, you said that we've established the base on all of these taxes that we're collecting, and so the increment above that is what's being used to pay this down. And so, in essence, this is not, if it works, this is not an appropriation by the state for a private entity. It's a capture of the increased revenues by the activity. So this is purely a return on investment activity, and we're using the state structure to facilitate this for an important private enterprise located in the state of Indiana. Is that correct?
Correct. I would just, with one a little twist there, if you turn to the next slide there, you can see on a year-by-year basis, we don't expect that the increment actually catches up with the state appropriations until year 17, according to the IMS's projections put together by Bill Sheldrake, who I believe is here with us today, if you have specific questions on that. So it is a little bit different than Stadium and Convention Center, which we were talking about just a few weeks ago, where on a year-by-year basis, there the local taxes are sufficient to cover that annual debt service. So
But in the end, this is not costing the taxpayers money.
Assuming projections play out the way that we think they will.
Well, since you've negotiated, I know that's going to be true, okay?
No pressure. And then, so any other questions? I know there's quite a bit of information here on this slide. So this just shows the breakdown of the various taxes collected in the district. And it just shows over time kind of how those taxes go to pay down the estimated
And I would
debt
like to
service.
point out that the admission fee, which is a fairly significant number in here, is one that the Speedway voluntarily agreed to on an upfront basis, and that the admissions fee affects the price of the ticket, and therefore they have to market within the ability to support that fee, which they don't get any benefit from directly as a revenue receipt. In other words, they have to price the tickets because the customer doesn't care whether it's a tax, a fee, or the price of admission. They just look at the bottom number. So I thought that was a pretty good cooperation point on their side, and I just want to make sure that we publicly acknowledge that.
Absolutely. And then the last slide in the deck just has a project description, just showing by general category the types of things that the IMS is contemplating at this point using the bond proceeds to finance.
Okay.
So we have lots of folks here in the audience who were from the IMS who were kind enough to take time out of their very busy schedules to be here with us today. So if y'all have any further questions for me on the deal structure or from anyone at the IMS on the project specifics, we'd be happy to take those now.
Well, let's take any questions of Kendra, and then, Mark, I'd like for you to step up to the microphone and give us your perception of this arrangement. Senator Italian.
Thank you. And thanks for this presentation. I really wish we'd gotten it a little earlier so that we could digest it before we had to ask questions, but notwithstanding. Let me just ask, last budget, didn't we appropriate like $5 million twice for this project through IEDC or something?
Yeah, that's a different, that's a completely different project, Senator. That's a project through IEDC not related to the IFA bond deal.
That was for the development of the motorsports industry, which has proliferated all around the state.
Okay,
and
so that's totally separate from this.
It is, and I might mention that although as you would suspect, there is a concentration of that activity around the Indianapolis Motor Speedway and in that area of the state. That actually extends into almost every county in the state in terms of businesses that participate in that arrangement, and the IEDC is running that program.
Yeah, there's been some confusion about that, admittedly.
Other questions for Kendra? Well, Kendra, thank you for your work on this project. And Mark, if you wouldn't mind, I'd like to hear from you.
Would you like a general comment?
Yes, I just want a general comment. First thing I want to know is, are you satisfied with this deal?
Yes.
Okay. And then perhaps if you have any additional comment, well, I would be glad to receive it.
Thank you. Thank you for giving us the time today and for your support of this all along. I would echo Kendra's comments that we are satisfied with the deal. I think it's, from our perspective, fair for the taxpayers and is going to be important to the growth of the Speedway.
Well, Kendra, when will this close?
Ooh, $1,000,000 question.
That was my next comment. Let me set up, if I may, her answer to that question.
Okay.
This has taken longer than we all anticipated.
That's right. I mean, I thought it was because I was threatening to file a bill again in January that Kendra decided to finally get it done.
But I think the time has been well spent. On our side, we've had a chance to get into much greater detail on exactly what the best investments will be, and that's helpful. Saying that, we are determined to have this money invested and the benefits beginning to accrue for the 100th running of the Indianapolis 500-mile race, which is May of 2016. We really can't do most of the work during this racing season, which is beyond May, but through the other events that we have during the summer. So we just have to have this done and the funds available so that we are, at speed in terms of starting the improvements so they can be done for May of 2016. So we're happy with where we are. It can get done. All the details can be worked out, but there's no time to spare at this point.
Well, the Speedway has been just an enormous success story in the state of Indiana for 100 years or more. And I think it's very important at this point in time to acknowledge the fact that the Holman family had made it a huge success over many years without ever having any state relationship, and in particular not asking for any state money. And when this, as time goes by, businesses always need to, particularly those with this high exposure level, they always need to be improved and reconditioned with the times that are prevalent moving forward. And so the Holman family was, as this discussions began to occur on this exercise, they were very cooperative and very willing to enlarge their board, to bring in outside board members for the first time in the history of their company. They were very willing to hire new management, so to speak, and do all the things that you have to do to change a huge operation into a newer, more successful operation. And then lastly, their agreement on the terms and conditions of the arrangement are such that although they are getting some benefit perhaps of a better priced loan that they might get otherwise, that in actuality they're going to do all of the hard work of making sure that the revenues raised to pay for this are those revenues that come from an enhanced enterprise out there, including, as I mentioned earlier, a willingness to swallow a ticket tax as part of the project. So I think it's important that we recognize the balance of this in terms of a public-private partnership, and quite often it just seems that people feel that our activities here in the State House are that there are some people that are the favored customer and they get state subsidies at the expense of other taxpayers, and that this has been done on a strictly a business arrangement for the benefit of the Speedway and to the benefit of the state of Indiana with one of our crown jewel enterprises. So I appreciate your working with us, Mark, and and I hope that we can successfully conclude this. So are there other questions or comments from members? Thank you very much. Kendra, you're doing lots of new and exciting things. The Ohio River Bridges project is another one that I think is going to be a real plum crown jewel for us. Bring us up to speed on that.
Absolutely. I've been before you all quite a few times recently on Ohio River Bridges, which I think is appropriate given the magnitude of this project. I'm here today, I'll just kind of cut to the chase. I know you guys have got got some more fun stuff to attend to besides this. The bottom line is, I think you have some slides in front of you. Slide 1 just has a map just to kind of reorient everyone to the project. Again, East End Crossing, which the state of Indiana is responsible for, is sections 4, 5, and 6 on the map. Sections 1, 2, and 3, again, are KYTC. That's the bridge into downtown Louisville on I-65. That's Kentucky's responsibility. The upshot, the bottom line of why I'm here today is actually on slide 2. As we've discussed before, we structured this deal, again, as a refresher. The most expensive part of the financing in these public-private partnerships is the financing that goes into these projects at the beginning during the construction period. That's the most expensive capital for the developers in these projects to raise. And so we, in Indiana, being leaders and pioneers in P3 in the nation, really came up with this concept of milestone payments to help reduce that cost of capital during the development period. And the concept here is, as the developers hit certain milestones in construction, we'll make payments to them, kind of progress payments, so to speak. We call them milestone payments. So as these milestones get hit, they get a payment. Therefore, they don't have to go out and borrow the funds at a high cost of capital that'll ultimately be passed on to the state. So as we were sitting down with the NDOT folks and coming up with the milestone payment schedule for this project, the milestone payment schedule that we came up with that made the most sense and we could get the most bang for our buck, so to speak, didn't really match up with the appropriations that Dan Broussard at NDOT had already kind of budgeted into his NDOT budget. We had a mismatch there. So we wanted to make payments to the developer, again, that didn't match up with the appropriations that NDOT had requested. So we've known all along since we structured this deal that we had a kind of a cash flow mismatch there. And the plan was essentially for the IFA to just do a short-term note deal, essentially, go out and borrow those funds, make the payment, and then repay them once the appropriation became available. We were actually approached by the federal government. There's this program called TIFIA. It's a U.S. Department of Transportation program where basically very low cost of funds are made available to state governments for infrastructure projects. And we were actually approached by US DOT, largely, I suspect, because the Ohio River Bridges project has just gotten so much notoriety. It's been such a roaring success. I think US DOT was anxious to maybe get involved somehow. So we were approached by them. They said, hey, would you all be interested in a TIFIA loan for your milestone payment mismatch? We said, well, maybe, what do you think? So the bottom line is the cost of capital for the TIFIA loan is actually less than even I can do for NDOT through the IFA. If you turn to, let's see here, I think slide 3 has the loan terms. As you can see here, the interest rate for the TIFIA loan is 2.47%. I mean, that's just the cheapest funds you can possibly get. So again, much like the IMS project, since this TIFIA loan will be backed by an appropriation from the state, the statute does require that I come before you all and that you review the transaction.
And you're allowed to prepay this at any time. That's
Thank
a
you.
pretty
Thank you for
amazing term there.
Huge. That's another huge benefit to this deal is, yeah, we can prepay.
Yeah.
So to the extent toll revenues come in, if toll revenues blow the doors off, as we all expect and believe that they will, then Dan can actually prepay this loan early with no penalty or cost. So that's another huge, and as you probably know, a short-term IFA note deal wouldn't have that flexibility at all. So it's really a good deal. If we can just get through the bureaucracy of dealing with US DOT, it'll be a great deal for the state. So.
Question. Chairman Brown.
Yes, thank you, Kendra. It sounds exciting. Is the interest rate fixed or does it float?
Nope, fixed. And the other great thing about it is our mismatch really doesn't, as you can see here, our mismatch really doesn't happen until fiscal year 17, but we can lock rates in. That's why we're wanting to get this thing locked down. If interest rates are going to go up as everyone thinks that they will, don't think that they can really go a whole lot lower. We can lock our rates in at closing and not draw until 17. So it's essentially a free rate lock also. So it's a great program. It really is. So.
You didn't quite go through the whole thing. Is there?
Yeah.
Okay.
So again, slide 2 just shows kind of where the milestone funding gap occurs there in 2017. The loan terms are laid out on slide 3. As you can see there, we're looking at that $162 million, which is the shortfall. The drawdown date would be in fiscal year 17. We're, again, looking at a 15.5-year term, but again, we can pay it down anytime. Debt service is expected to be $13 million, and again, the security behind this is a state probe. Right. So there will be, turning to slide 4, much like the highway revenue bonds that you all are very familiar with, there'll be a use agreement between the IFA and NDOT, so that'll be the mechanism. That'll be kind of the lease, like the lease that we just talked about in the IMS deal. That same legal mechanism will be in this deal as it is in all the IFA deals between the IFA and NDOT to get those payments over to the IFA once the funds are appropriated to NDOT. Slide 5, I think we've probably hit most of these. Again, we're very effectively funding this milestone gap, a free rate lock until fiscal year 17. We can draw the funds when needed. We don't have to draw them all down at closing. No prepayment penalty. And this very efficient structure essentially puts money in NDOT's pocket to deal with some of the preservation issues that I know NDOT's been here talking about. So it's really a great program. Slide 6 just has a basic schedule. Again, we're really trying to get this thing nailed down to take advantage of these low rates. The schedule here on page 6 shows us getting to financial close on March 7th. So I'm going to try to get this one nailed down pretty quickly first quarter.
Questions for Kendra? And then the other thing is whether you're making progress on the toll structure that you're trying to put together. I know that there are this is a fairly complex process, and there are different issues that are arising out of that. So, you and I have discussed it, and it seems that we feel fairly confident that the thing is working the way that it needs to work.
Absolutely. Yeah, we will be tolling when the bridge opens on Halloween of 2016. We will be ready to toll the bridge.
Well, the Budget Committee had the opportunity to visit down in that area, and we know that that's going to be a huge economic boost for the greater Louisville area, and actually Indiana appears to stand to gain the most if we can get all this to work out.
Absolutely. It's an exciting project.
Okay, other questions for Kendra? Thank you for a job well done on both of these projects. I'm going to get a report on the E911 system from the Treasurer's Office, and I see that we have our new treasurer here today. Is that right? Well, thank you for coming. And
I am here in my role as chair of the statewide board of 911.
Right.
With me, of course, is Barry Ritter, our executive director, who will actually present the report. But I'm proud to be here, proud to be chair of the board. I think we all should be rightfully proud of our 911. I don't know if you know, but Huntington, Indiana was the second place in the country to offer 911 services in 1968.
Wow.
And we've been a leader ever since in 911, including being a leader in the country this year in rolling out text to 911. With that, I will turn this over to Barry.
Thank you, Kelly. Mr. Chairman, committee members, you do have a copy of my report. We are here because the statute that was passed in 12 required us to provide you with a 2-year report on the operation and administration of the 911 fund that is not an appropriation from the state, but is revenue that is collected from a fee on the communication device bills of citizens in the state. The 3 milestones, has the fund been administered by the board within the chapter? Has the fee been reasonable and necessary to provide adequate and efficient 911 service? And has the fee been used solely for the purposes set forth within the chapter? And I'm happy to report to you the answer for those 3 provisions is yes, and that we have held the counties harmless in the distribution from day one of this bill going into effect, and the funds being distributed to county government for the operation of their 911 centers. In addition, the state, through its vendor, operates the largest public safety EZNet in the country, and over 80% of all 911 calls made in the state of Indiana come from a wireless device and are delivered over that network. So again, we lead the country in our technology capabilities for delivery of 911 services.
I know that Senator Hirschman was instrumental in negotiating fees and the rates and what the state would pay, and then what the local contributions were supposed to be. And I'm hearing some rumblings that there's still concerns in some areas of the state or some counties about how they want to continue to do this. I assume that you all play an active role in evaluating these situations in each part of the state. Is that correct?
Correct.
Yeah. In that light, some of the counties are coming to their legislator for what they think they need in terms of relief. And because of Senator Hirschman's involvement and understanding of how the thing was put together, most of us want to, at least in the Senate, want to defer to him to help not only come up with the right answer, but to take the history of how we got here into account. So I hope you all will do that as well, and that we can have a coordinated effort between the legislators that may have an interest and your office, and then the local elected office holders. And I think that you all will have a particular challenge of making sure that we hear the locals on their concerns, and that the solutions take into account the most complete assessment of what the best way to do this is, because it's one of the there's a little bit of a thankless nature to this job, but I know that you're aware of that. But we want to make sure that you stay on top of that and try to coordinate with all these different interested parties.
We have prepared a 5-year plan that we will present to Senator Hirschman for consideration on what we project for revenue over the next 5 years as Indiana migrates to a next generation IP network, and what that will take to accomplish.
Well, I appreciate you taking that proactive approach, and maybe, Kelly, we can continue to be a leader in this area if we do that. Are there questions from committee members on this presentation today?
Senator, may I just say, as a
Certainly.
County Commissioner, I have great sympathy for the local view of this as well, so we will definitely be listening to their views.
I didn't know you were a past county commissioner, and that's actually a great asset for you to have in dealing with this specific situation. I'm glad that makes me feel better already. So that's good. Anything else you'd like to add? All right. Thank you for coming today.
Thank you.
Let's see. We have some state plan amendment information from the FSSA. Is Joe here to present that? All right, okay, there's Joe. Good. Joe, can you walk us through what you have for us here today?
Sure can. Senator Kinley and members of the committee, I have 7 items to present today. to the committee. The first 6 are related to HIP 2.0, and the 7th and final one is related to HIP 1.0. The first 6 take steps to implement the HIP 2.0 proposal by submitting state plan amendments to the federal government to accomplish the policy goals that we set out in the proposal. The first item is the increase of the eligibility levels to 138% of the federal poverty level. This is the level in accordance with the expansion outlined in the Affordable Care Act, and our HIP 2.0 proposal would have us go up to that level. So this first one makes the change to allow us to expand up to that income level. The costs associated with that, we put the fiscal impact of the entire proposal under the first item, but the subsequent items I'm going to talk about today all have the same cost.
You know, this is fairly technical, and I kind of grasped this as I went through it and had it explained to me. So holding the last item, which is in the event that we stay under the 1.0 plan, do the committee members have questions about the first several items? Have you had a chance to look this over enough to be able to develop a question? Representative Gooden?
It's a generic question. I know that we're still in negotiations with the feds for both sides of this. It seems that the federal government is now positively looking at our proposal as compared to maybe 3 months ago when they were not necessarily there. Do you have any insight into kind of where this is going and when they'll make an announcement?
We're having constructive discussions with the federal government. Those discussions are continuing. We are making progress, but we're not there yet, and there are some issues that remain. So we're hopeful that we'll get approval soon so that we can start this program early in 2015. But that is contingent upon getting the approval in a timely fashion.
And so the first 6 items here are really amendment requests that would be conditional on you getting that done. Is that fair?
Many of these we have gone ahead and submitted.
Okay.
And if the approval does not happen, then they will not take effect.
Okay. Chairman Brown?
Yeah, my follow-up would be, thank you again for coming, would be in relationship to that. Would they be on our books forever, though, if we never go to 2.0? And would you commit to us maybe in a year, 18 months, or 15 months if we don't go to 2.0? We take these off our books so they don't stay on our books
Well,
forever?
they would not get approved if the overall proposal was not approved. So we've submitted them to the federal government, but they're pending approval from them. That's typically a multi-month.
So it only
process.
goes on the books if the feds approve?
That's correct.
Okay, thank you.
Okay. Other questions or comments? Yes. Representative Klinker?
Mr. Chairman, do you think that there will be a time, and I know other states do this, and maybe Indiana purposely does not do this, where we would be helping either our migrant workers or our illegal immigrants? I know in our area, several of the folks try to go to WIC and some other areas to get help for prenatal care, and they're not allowed to do that, where other states do allow that. Do you think that will remain a situation that the state of Indiana will probably deny those folks?
That would be a policy choice.
Right.
Ourselves and in conjunction with the state. I will say that we have an emergency services program for undocumented immigrants where they can get emergency services only. We're under the Medicaid program, full Medicaid benefits, but if they get hurt or injured and they need emergency services.
In hospitals?
Yeah, in hospitals, we cover that today.
Well, I know several of the folks go to Riggs Community Clinic, but many times the doctors do not want to handle those situations because they're not Medicaid eligible.
Joe, is your microphone on?
I believe. Yeah, it's on.
Yeah, Senator Italian.
Thank you. This is just a kind of procedural question. So these changes, are we being asked to put these changes in the budget and they'll be there in the event that sometime over the next 2 years we get approval? I mean, to this? Right. No, but I mean, there's, some of this requires money, right? Some of this requires state money.
Well, it's not out of the general fund. HIP 2.0 is funded through the hospital assessment fee and the cigarette tax and the federal funds. So,
Yeah, I think.
and tomorrow
Yeah, tomorrow when they present the Medicaid forecast, that it includes all of these contingent discussions.
Right. All I'm trying to find out is whether, are we putting something into the budget language this year that will cover the possibility that we get approved sometime over the next 2 years? I mean, is that the way this works?
Yeah, the forecast is designed, is premised on that.
Okay, all right.
Yeah, Representative Gooden, I may not be following the exact nature of your question here, but Representative Gooden?
My understanding, of course, is it's 100% paid by the feds for the next, until what, 2016, 17? When is that?
The 100% funding is for the first 3 years, so it would
Okay.
go through calendar year 15 and 16.
Okay.
And that's for services,
Right.
for the cost of services. The administrative costs and costs of increasing the physician fee schedule and regular Medicaid are not covered by 100% federal funding. And the cost of the current Medicaid populations we're putting into HIP 2.0 is covered at the regular match, not the 100%.
Right. All right. Thank you.
Thank you. Anything else? Okay, then the last item, Joe.
Okay, sure. This is a continuation of the current enrollment freeze in HIP 1.0. You probably are aware that about a month ago, we received approval from the federal government to continue the Health Indiana Plan 1.0 program for the next calendar year through December 31st, 2015. We did institute a freeze on enrollment back in July because the program had reached capacity and we were at risk of exceeding the level of revenue from the cigarette tax to fund more enrollment into the program. We project that that will continue throughout next year at the enrollment level that we're at today. And so with this waiver amendment, we're requesting from the federal government a continuation of the current enrollment freeze throughout the entire 2015 calendar year.
Questions? Thank you, Joe.
You're welcome.
Last presenter is the IEDC. We have Steve Acard with us today. Steve, tell us what you've got for us here.
Thank you, Mr. Chairman, members of the committee. We have three investments from the 21st Century Fund for review. The first is Confluence Pharmaceuticals. This would be for a $2 million convertible note. It's matched by some private co-investment of the same amount. This is for a therapeutic medication to treat autism-related disorders and Fragile X syndrome, and it would be for a repurposing of a compound for those two specific indications.
Okay, next.
Second is Healthiest Employer in Hamilton County. This is a $500,000 convertible note matched by $1 million in private co-investment. It's for managing data related to health and health outcomes, and for large employers to oversee and use the data to improve outcomes and costs for employers.
Questions? Next item.
Is Sound Decision. We may recall it under the name of Cloud One. There was an approval of this one a couple of years ago. This would be an $800,000 follow-on investment. There's $3.7 million in private co-investment. This is a cloud-based management service for users of an IBM platform that is continuing to grow.
Questions? Okay, then we have the Purdue Foundry Program, is that right?
You may recall from the last meeting, we started this, the Foundry Program, looking at commercialization of university student faculty-based projects. These are small scale, so there are 10 of these that we're presenting, each of the $20,000 range would be also notes. These are the first, what would be the first phase for these individual projects. They would be followed on by certain metrics, assistance through entrepreneurs in residence, where they would reach a next level of potential investment as a follow-on. And this is a program we began this year. We're in discussions, very exploratory at this point, but we're hoping to take this statewide. We're currently talking with IU and also Notre Dame as an expansion of this program.
Steve, can you summarize on the Foundry Awards? I think this is a pretty good partnership that we're trying to develop here. Can you just give us a little general discussion about kind of what the policy of the program is and what it's supposed to accomplish for us here?
We are, through the Foundry, we are partnering with the Purdue Research Foundation and Purdue to help identify very early stage ideas coming out of student and faculty research that we would then foster through a community concept. That's the Foundry concept, is a community of tech and like-minded people that would work together, be able to utilize university assets, university research, and experts, also combining that then with entrepreneurs who can advise on the business side of this. And it's meant to be not at the scale of the traditional 21st century projects that we talked about, but very early stage, to help really start up those projects.
And what would be an example of how this might develop and how the state would get a return on this investment?
We would then do a co-investment with Purdue. So the $20,000 would be invested through a convertible note, much like what we do with the 21st Century Fund. It's just a smaller amount.
And then, so do we have questions about the Foundry? This is the first time we've seen this request, so I want to make sure that everybody has a chance to understand it's a new thing, so.
I just want, I'm not sure that this qualifies as C.
As what?
The font, yeah.
Does this come with like magnification?
Hopefully, that can be magnified on a computer.
We just wanted to make sure that you had access to all the information, Senator Tran. Okay. If there's no more questions, then you have one more set of the SBIR program that you're doing here that you're going to tell us about. Is that right?
Mr. Chairman, finally, there are 3 grant proposals here from the Small Business Innovation Research Program. You may recall we also resurrected this program earlier this year. These are $50,000 matches against a federal grant that we now match.
So you're getting about a 4-to-1 grant from the federal government on the total of these.
That's right. So there is an initial match, and then actually once we bring in our match, they can qualify for additional federal funds.
Okay.
Too, right?
Questions on this effort? Okay, I guess not, Steve. Thank you. Okay. So at this point, are there any motions to remove any items from the agenda as presented? And I would entertain a motion to formally adopt the approved agenda. Been moved and seconded that we formally adopt the approved agenda. All in favor say aye. Aye. Any opposed? Okay, we will meet at the designated location at 12:30 and begin the celebration. Thank you, members.